Hey, good morning, everyone. Good morning, and welcome to this hearing. Before I gavel in, ask a good friend and colleague from North Carolina to, if he would, just offer a blessing over our proceedings today, and then we'll gavel in after that. Mr. Davis.
Thank you so much, Mr. Chair. Let us pray. Oh, Holy One, we come before you now, and we're just so thankful for this opportunity for this day. We're thankful for the opportunity to talk about agriculture as we prepare to proceed today. Be with our chair, our ranking member, all of the committee members, our witnesses, and all those gathered today. Allow us insight into your wisdom. It's these things we pray. Amen.
Amen. Thanks, sir. The committee will come to order. Welcome and thank you for joining today's hearing entitled Innovation, Employment, Integrity, and Health, Opportunities for Modernization in Title IV. After brief opening remarks, members will receive testimony from our witnesses today, and then the hearing will be open to questions. Good morning once again, and welcome to this morning's hearing on the nutrition title of the Farm Bill, and thank you to our witnesses for sharing their time, their expertise, and their vision. Last week, the Supplemental Nutrition Assistance Program, or SNAP, became a significant focus of the debt ceiling negotiations, which laid bare the strong emotions and opinions across the political spectrum. But when 1 in 4 Americans participate in at least one of the U.S. Department of Agriculture's 15 food and nutrition assistance programs over the course of a typical year, it's time to redefine success. Now, I believe we can all agree, I'll bet through different lenses, there exists an opportunity to advance meaningful legislation that moves people forward while meeting their dietary and their financial needs. However, I am firm in my belief that smart policies do not equal indiscriminate expansion of these programs. I've also been involved in shaping federal domestic nutrition policy through my work on the House Committee on Agriculture and the Committee on Education and Workforce. Now, I value these programs, advocate for them, and understand there's room for improvement. My goal is preservation for those truly in need, a recognition that sometimes our neighbors in need require a helping hand. With the Farm Bill set to expire, we as policymakers can build on the success of the 2018 Farm Bill and find opportunities to foster self-sufficiency, promote health, explore innovation, and ensure taxpayer resources are used most effectively. First, we must continuously explore how to serve eligible recipients through innovation and flexibility. If the pandemic has taught us one thing, it is there is no one way to serve families in need. Midwest Food Bank has found a way to immerse itself deep into Appalachia, and I look forward to hearing more about how they and we can meet people more efficiently where they are, whether in urban or rural communities. Second, we must think about the best ways to guide recipients to independence through employment and the role that career and technical education plays in that transition. Let's move from states going out of their way to keep employable individuals idle and disengaged and spend more time fostering connections with employers and education providers. Dr. Rashidi has studied this extensively for decades, and her testimony is integral to how we should think about an expectation of productivity and its outcomes on health and communities. As an aside, in talking to organizations that provide case management, placement, and retention services, I'm encouraged to hear clients over the age of 50 report more employment than those under 50. Report incomes on an average of $500 more per month than their younger peers and hold employment longer. As, quote, older Americans, end quote, can still contribute to the labor force in our communities and should not be thought of incapacitable or incapable or hopeless. Third, we cannot deny program integrity has been compromised. As policymakers at the federal level, we must ensure USDA returns and maintains the virtues of our domestic nutrition safety net. But our constituents also have a role here, from maintaining vigilance at checkout to lessen chances of skimming to small businesses taking a chance on a recipient. We can all come together to restore and sustain accountability to the taxpayers, footing the 10-year, $1.2 trillion cost of these programs. The United Council on Welfare Fraud provides compelling reasons for these reforms and more. And last, and perhaps most importantly, the promotion of healthy eating. Employment, healthcare costs, military readiness, education, and general longevity highly depend on the foods that we consume. With the right resources, research, modernized programming and technology, and appropriate and effective federal dietary policy, USDA, states, and local communities are uniquely positioned to improve the nutrition of millions of households. Dr. Stover will share his experiences, but most importantly, his vision to bring about a healthier America. The nutrition program in the Farm Bill shows the world how we as a nation take care of one another. And if we can put politics aside to have honest dialogue, promote pragmatic policymaking, and commit to good governance, we can move mountains for those in need. And with that, I pleased to recognize and welcome the esteemed ranking member from Georgia for any opening remarks that he would like to make.
Thank you very much, Chairman. Let me say this at the outset. My Democratic colleagues and I have said, and we will continue to say, we stand united against any efforts to take food away from children, families, or any vulnerable American in this Farm Bill or any legislation. We stand united because we can also surely find areas that we can work together in on a bipartisan way. I know, Chairman Thompson, your priorities are innovation, employment, integrity, and health opportunities. Well, we Democrats, we Democrats care about these issues too, and we can work with you in a bipartisan way. Innovation, for example, we can use innovation to improve program access, improve application and processing time. On employment, we can provide additional support to help participants get and retain jobs. And we also need to take the time to look at the impact of artificial intelligence. Let me tell you that artificial intelligence is moving rapidly and replacing many jobs that lower income people once had an opportunity to do. I was eating at a restaurant in Atlanta, and it was a robot that brought my menu and a robot that brought the food. Now, those were jobs that once were had. We need to look at AI. We need to also examine the rapid move in technology that are making many jobs beginning that lower income people once had no longer are there. We got to provide support like transportation, that's one of your initiatives, child care assistance, which research has shown time and time again does more to encourage employment than any punitive time limits. And we can now assure that education, something critical to job readiness. And as I said, with the movement in technology, education becomes even more environment. One of your goals is on integrity. We can combat EPT skimming so no one can lose their benefits because of a fraudulent action. You mentioned on health. We can incentivize healthy eating and improve SNAP nutrition education. Incentives work. Look at GutSNP, the program's great impact on fruit and vegetable incentives. And also, I want to say a big thank you to President Biden's leadership, because the recent debt limit agreement included a new exemption from the time limits for our precious military veterans, for homeless people, and for children of the foster care movement. And I, unfortunately, deeply remain disappointed that the debt limit agreement included a harmful SNAP provision that puts food assistance at risk for 700,000 of our older senior citizens. We need to work on that. And I just want to reiterate that we Democrats stand united against any efforts to take food away from veterans, from children, or any families that are vulnerable in America. We're too big a country. We're too great a country to let anybody go hungry who need help. We need to provide proper and humane food assistance to our precious American citizens who are in need. Thank you.
I thank the gentleman. The chair would request that other members submit their opening statements for the record so witnesses may begin their testimony to ensure that there is ample time for questions. Our first witness today is Ms. Tiki Brown, who is the Assistant Commissioner for Children and Family Services at the Minnesota Department of Human Services. Our next witness is Dr. Patrick Stover, who is the Director of the Institute for Advancing Health Through Agriculture. To introduce our third witness today, I'm pleased to yield to the gentleman from Illinois, Mr. Sorensen.
Thank you, Chairman. I'm very happy today to be able to introduce a guest from my home state, Mr. Eric Hodel. Mr. Hodel is the CEO of the Midwest Food Bank, which operates in my home district and serves as a lifeline for constituents in Peoria, Morton, and Bloomington Normal. Midwest Food Bank currently distributes $34 million worth of food to over 2,200 nonprofit organizations each month, with 12 locations in Illinois, Arizona, Florida, Georgia, Indiana, Texas, Pennsylvania, New England, East Africa, and Haiti. Mr. Hodel, I'm proud of your work in Illinois 17. Thank you for your testimony, your time, and Chairman, for the ability to introduce him. Thank you.
Well, I thank the gentleman from Illinois. Our fourth witness today is Ms. Dawn Royal, who is the Director and past President of the United Council on Welfare Fraud. And our fifth and final witness today is Dr. Angela Rashidi, who is a Senior Fellow and Rhodes Scholar at the American Enterprise Institute. Thank you all to all of our impressive witnesses for joining us today. We are now going to proceed to your testimony. You'll each have 5 minutes. The timer in front of you will count down to 0, at which point your time has expired. Ms. Brown, please begin when you're ready.
All right. Thank you, Chairman Thompson, Ranking Member Scott, and members of the committee for the invitation to testify before the House Agriculture Committee. I am Tiki Brown, Assistant Commissioner of Children and Family Services at the Minnesota Department of Human Services. With more than 20 years of state government experience, including serving as Minnesota State SNAP Director for 4 years, I'm pleased to share Minnesota's perspective with all of you today. First, I'd like to thank the committee for its work to provide states with SNAP emergency allotments, quality control flexibility and waivers, and additional flexible administrative dollars to manage the pandemic response activities. Combined with the careful use of waivers, these resources allowed Minnesota to seamlessly deliver critical services while ensuring a payment error rate below the national average. We took many lessons from our pandemic efforts, including the need to improve program access. Those improvements include MN Benefits, an online application for public assistance benefits, which moves from a paper-based application to a mobile-friendly online version, reducing completion time from 1 hour down to 13 minutes. 17 stores now participate in online grocery shopping, which has been an important option for rural residents, seniors, and participants with disabilities. Contacting SNAP recipients via text messages ensures that they are aware of important changes in their SNAP benefits. It improves communications with workers, and we are able to collect recipient feedback. Minnesota is rapidly expanding texting capacity and has found texting to be a reliable and impactful tool for communication with participants. The last several years have emphasized both the strength and the fragility of people. We understand many of our program participants hope they never have to rely on SNAP. However, a personal crisis, a job loss, or a global pandemic shakes their very foundation, which results in a need to ask for help. We know SNAP is paramount in the health and well-being of program participants. Referenced in my written testimony is a recent study conducted by the Minnesota Department of Human Services and Johns Hopkins University, which found healthcare costs decreased by an average of $99 per day when people have access to SNAP. And as you know, the majority of SNAP participants are children, so it will come as no surprise to hear additional studies conducted by my department found parents describe the toll a lack of food takes on mental health. These parents also sadly share their own stories of choices they made to go without food for the sake of their children. In our social safety net, many fibers are required to support the most vulnerable: transportation, housing, healthcare, childcare, livable wages. Our participants' lives are complex and they have complex needs. Alignment across programs is critical, and our SNAP policies require attention to the barriers participants face. This is most evident when we look at inequities in Minnesota's labor market. Our unemployment rate is less than 3%, and yet unemployment rates for our populations of color and American Indians are significantly higher, and many struggle to enter the workforce. Policies around time limits must consider the unequal impact on race and ethnicities in different communities. As we look to the future of SNAP, Minnesota is excited to continue its efforts with tribal nations by expanding their ability to provide benefit eligibility to their members. We will continue to increase the number of diverse organizations providing employment and training services and continue to improve our technological capacity through pilot projects like our upcoming FNS-funded Rapid Cycle Evaluation Texting project to boost participation in SNAP employment and training. We also have challenges to overcome. As an 87-county and 3-tribe administered state, our county and tribal partners are burdened by staff turnover, workforce shortages, and an increased caseload and a high number of applications. Some counties have a turnover rate in the 50% range. In order to compensate, experienced staff worked an unprecedented number of overtime hours, doubling expenses in 2021. System complexity creates an additional challenge. Intricate and interrelated programs result in public assistance systems with complex and rigid timelines. These systems require a careful allocation of staff resources and expertise to avoid case closure and unnecessary churn. And flexibility remains key. Minnesota recently approved SNAP interview waiver gives counties and tribes flexibility to work with participants on the information needed to reduce burden rather than follow a more rigid interview process. In closing, we are committed to the critical role of SNAP. It has been a privilege to meet the needs of participants during such a challenging time in our nation's history. We must continue to do so in this time of recovery. Thank you.
Thank you, Ms. Brown. Now please recognize Dr. Stover. Dr. Stover, please begin when you're ready.
Chairman Thompson, Ranking Member Scott, and members of the committee, thank you for the opportunity to testify before you today. My name is Dr. Patrick Stover, and I serve as Director of the Institute for Advancing Health Through Agriculture at Texas A&M. I oversee a unique research institute that aligns agriculture as the solution to skyrocketing rates of diet-related chronic diseases that are driving unsustainable health care costs and making both young and adult Americans sick. Today, I will provide my perspective on the state of agriculture and food and its connection to hunger and human health, as well as the enormous challenges we face. But more importantly, I will emphasize the opportunities to reimagine the role of agriculture in transforming our lives. First, for some context, Norman Borlaug won the Nobel Peace Prize for sparking the Green Revolution by transforming global food systems to be abundant and affordable, which dramatically reduced hunger. Today, we face a growing crisis of diet-related chronic disease, which costs the U.S. economy over $1 trillion annually and affects half of adults. We need to build upon Borlaug's legacy by expanding our mission, from using food to eliminate hunger to using food to become healthier. This can only be achieved by innovating throughout the entire food supply chain, not by merely focusing on agenda-driven preferences and opinions and around what some proclaim to be healthy foods. Today, hunger and food insecurity still exist, but not because of insufficient food production. On the other hand, American diets are responsible for billions of dollars in healthcare costs. We must expand the goal of agriculture to include both hunger and health. We know that chronic diseases are disproportionate in rural and other underserved, underrepresented, and low-resource populations, while the associated health care costs are shared by everyone. We all have a stake in finding solutions. We need to work together, and everyone needs a seat at the table. I am grateful for the new investments from Congress and the state of Texas that has enabled us to launch the Institute for Advancing Health Through Agriculture, which is focused on advancing research that connects production agriculture and human health. Our focus is on bridging the gap between precision nutrition and the land-grant university agriculture research complex that is the envy of the world. We are addressing the most pressing problems facing our nation and the world. I'd like to highlight 3 initiatives that we are undertaking to make agriculture the solution to human health. First, we are now collaborating with the Chicago Council on Global Affairs, with experts nationally, to identify priorities and related barriers to make agriculture the solution to human health. We will make recommendations on actions we can take now and what actions are aspirational and require more study. Second, we have launched the Agriculture, Food, and Nutrition Scientific Evidence Center. We must have confidence in the quality of scientific evidence that serves as the foundation for our policies, practices, guidance, and programs in the agriculture and food space. We must ensure we have science-informed policy and not policy-informed science. The newly created Evidence Center, located in downtown Fort Worth, is conducting state-of-the-art scientific evidence synthesis to provide decision-makers with objective analysis on what the current science says regarding any proposed change in policy, practice, or guidance. Third, we have launched a major maternal diet and child health study. Science has revealed that the risk for diet-related chronic disease begins very early in fetal development and is influenced by diet. We are launching a major study to understand the role and contribution of maternal diet during pregnancy to lifelong risk of chronic disease in both mothers and their children. In conclusion, we must align agriculture with human health. Diet-related chronic disease places a huge financial burden on individuals, the healthcare system, the American economy, and are crippling the quality of life for many Americans. While historic efforts to eliminate hunger and food insecurity continue to be important, hunger cannot be considered in the absence of health. To put it bluntly, this disconnect between food and health threatens agriculture, the food supply, the health of our society. Fortunately, agriculture is uniquely positioned to be the solution. With that, thank you again for this opportunity to testify, and I look forward to your questions.
Dr. Stover, thank you so much. Now please recognize Mr. Hodel for, please begin your testimony whenever you're ready.
Chairman Thompson, Ranking Member Scott, and members of the committee. Good morning, and thank you for the invitation to participate in today's hearing. My name is Eric Hodel, and I serve Midwest Food Bank as the Chief Executive Officer. I'm honored to have a seat at the table today. Midwest Food Bank was founded by a farmer 20 years ago. I, too, was raised on a farm and continue to manage a 1,400-acre grain and livestock farm in addition to my responsibilities at Midwest Food Bank. I come today understanding the impacts of agriculture policy as both a producer and servant to the food insecure. Thanks in advance for the important work and policies the Ag Committee supports through the USDA. Food insecurity is real. It is besieging our urban and rural poor, grandparents on Social Security caring for grandchildren, struggling single parents, and the underemployed. Every day, Midwest Food Bank rescues food that would otherwise be discarded and efficiently distributes it to our nonprofit agencies and food recipients. My ask today for the Committee on Agriculture is simple. Continue providing programs and support that are open and inclusive for all food banks to help put food on the table for the nearly 35 million Americans who live in food insecure households. I'm prayerful today's testimonies and discussion from all of us will provide the innovative ideas needed to change the trend line of food insecurity. After 2 decades of sustainable growth, our values and missions remain steadfast. In 2022, Midwest Food Bank distributed $415 million of food, including family disaster relief boxes. We have 10 locations across the U.S., 55 full-time employees, and 99.5 cents of every dollar is spent on program services. Our business model is simple. We receive donations of food, financial support, and volunteer efforts. With these 3 inputs, we deliver 4 programs: distributing food to nonprofit agencies, disaster relief, tender mercy nutritional meal, and weekend feeding program for school-aged children. We serve small to very large agencies, knowing they each have a role to play in providing food access. We do not collect payment from our agencies for food provided to them. This allows our agencies' operational costs to not be burdened and their local impact to go further. Some of our agencies will partner with their local grocery store and team together to purchase or receive donated food items to help supplement the MFB donated food. It's a collaborative and community team effort to fight hunger and serve food to individuals and families. We believe change occurs in the community, and our hope is to serve our food recipients for a season, not for a lifetime. We celebrated the downward trend in food rates of food insecurity across our nation in the decade leading up to 2022. And then unexpectedly, the pandemic catapulted more families into a state of food insecurity. Our combination of food distribution and disaster relief equipped us for this challenging season. The USDA Farmers to Family Food Box was a valuable resource for Midwest Food Bank. We distributed over 2 million USDA Farmers to Family Food Boxes, and we appreciate and applaud the USDA for the quick program execution. The program injected nutrition directly into the emergency food system. Never waste a crisis is a leadership model I firmly believe and follow. And so at Midwest Food Bank, we have taken the learnings from the Farmers to Family Food Boxes and improved our availability and our disaster relief boxes. We now provide our boxes for humanitarian agencies to deliver. We've also teamed with corporations to study data on the high poverty countries and counties in the United States. And thanks to their financial support to purchase food items, our volunteers assemble the family food boxes, and an agency in location provides delivery service of these food boxes to homes. Nearly 1,000 food boxes representing 15,000 meals are delivered each week into eastern Kentucky. Future projects and planning for expansion in Mississippi and Louisiana are underway based on data. Additionally, we have started a pilot program with a logistics company to keep family food boxes in inventory to help support the super rural communities. Their drivers will have access to shelf-stable food boxes to take out with them on delivery routes, and they can determine and share appropriately with those people battling food insecurity. As I mentioned, Midwest Food Bank has 10 main warehouses distributing food into 23 states. As we continue to grow, USDA's TFAB is an option we would explore and look for an opportunity to provide staple food options in addition to the industry-rescued food. We request an open bid process for all food banks to have an opportunity to apply. Moving forward, we will continue to pursue 4 opportunities: mission focus, nutrition, collaboration, and community partnerships. In closing, we ask the Committee of Agriculture to commit to an equitable policy that channel government resources to independent food banks to meet program requirements. Alleviating hunger and malnutrition is a complex challenge requiring a multifaceted solution. We ask for your continued effort to bring community-centric programs to the table. Together, we will provide food to families in need as we serve and support the communities across America with innovation and nimble execution.
Mr. Hodel, thank you very much. Ms. Royal, please begin when you're ready.
Chairman Thompson, Ranking Member Scott, members of the committee, thank you for the opportunity to address you today. My name is Dawn Royal. I'm a current director and 2-term past president of the United Council on Welfare Fraud, commonly referred to by its acronym UCOF. The United Council on Welfare Fraud is a national professional organization dedicated to protecting the integrity of our nation's public assistance programs. We're the only national organization singularly focused on the detection, prevention, and prosecution of welfare fraud. UCOF has over 1,000 members throughout the country who will proudly celebrate UCOF's 50-year history this year at its annual training conference. While I have always been aware of SNAP and its predecessor, the food stamp program, I didn't learn the importance of the program until I became an investigator 15 years ago. I think we all agree that the United States cannot claim to be the most powerful country in the world if our citizens are hungry. On this point, there can be no debate. The importance of a strong nutrition assistance program cannot be overstated. I volunteer my time to promote UCOF's mission, and I am intensely proud of my job as a certified welfare fraud investigator. My day-to-day duties are investigating allegations of fraud. I am on the front line, and I'm here to talk today about current real-world fraud in SNAP that happens every day. My days are seldom dull, not only because of the volume of cases I work through, but also because I don't work with hunch or suspicion. I have to find facts and evidence to prove or disprove allegations of fraud and misuse. As an example, I worked a case where a man submitted several applications over several years where he repeatedly stated his only source of income was a nominal amount from Social Security disability, and yet he reported he lived in a rented home in an area with one of the highest costs of living in the country. After my extensive investigation, I was able to prove multiple false statements, including the applicant was not a resident of my state, and that he and his family lived in a bordering state in a home he owned, as well as his 9 cars, motorcycles, and a sailboat. The defendant pleaded guilty to a felony and paid over $28,000 of restitution and a single payment he presented at his sentencing hearing. Members of this committee, it is investigators through this country who diligently work every day to detect, prevent, and prosecute fraud that keeps SNAP strong. We identify and bring those who take unlawful advantage of the program into the light and hold them accountable for their actions. There are simple measures that we can discuss today that can be included in the Farm Bill that will give immediate and substantial assistance to the fight of the ever-increasing occurrences of fraud that have become rampant in the program. First, additional funding, such as increasing retention amounts and mandating retention money, be used for the prevention, detection, and prosecution of fraud. Second, access to technology, including immediately implementing the National Accuracy Clearinghouse. And third, updates to antiquated policies, including geographical controls on EBT purchases. Thank you for giving me the opportunity to provide you with our views and what we in UCOF see as simple measures that will make significant strides in reducing fraud and abuse in this vital safety net program. We also sincerely appreciate the opportunity to further discuss the outstanding work investigators do every day and what you can do to help their efforts to promote and protect the integrity of the Supplemental Nutrition Assistance Program. So when America's vulnerable citizens need help, there is a strong and fair program standing ready.
Ms. Royal, thank you so much. And now we'll proceed. And Ms. Rashidi, please begin when you're ready.
Thank you. Chairman Thompson, Ranking Member Scott, and members of the committee, thank you for the opportunity to testify today on this important issue. My name is Angela Rashidi, and I am a senior fellow on poverty and opportunity at the American Enterprise Institute. I am also a former deputy commissioner for the New York City Department of Social Services, where for over a decade I oversaw the agency's policy research and evaluation, including of SNAP. As this committee considers a Farm Bill for 2023, I wanted to highlight 2 key issues as it relates to SNAP: employment and health. In the course of my research, 3 key themes have emerged. First, consistent and sustained employment is one of the most crucial ingredients for reducing poverty and increasing upward mobility. Second, poor health is one of the largest barriers to employment for low-income Americans. And third, SNAP's lack of dietary guidelines often leaves its recipients in poor health, limiting their ability to work and escape poverty. Let me begin by first acknowledging the ways in which the recently enacted Fiscal Responsibility Act of 2023 has improved the employment prospects of SNAP recipients. The Act strengthened SNAP's work requirements by extending them to more working-age adults. It also added as a new stated purpose to the program to help SNAP recipients find employment. But Congress can do more. SNAP should be helping people find employment, not discouraging it. Employment offers financial and non-financial benefits to individuals and the broader economy. As last month's jobs report showed, the U.S. continues to see strong job growth and low unemployment rates, but businesses continue to struggle to find workers. Safety net programs such as SNAP should support the broader economy by encouraging, not discouraging work. Yet SNAP participants have very low employment rates. In a recent report, my AEI colleague Thomas O'Rourke and I found that the employment to population ratio among non-disabled SNAP participants without children, what we typically think of as ABODs, has hovered between 15% and 30% since at least 1996. Our research also found that the composition of SNAP has shifted toward the childless. For example, in 1996, the share of prime-age SNAP household heads with children outnumbered those without children 3 to 1. But today, the ratio is 1.8 to 1. During this same time, SNAP expenditures have increased fivefold in real dollars. A longitudinal look at employment rates among ABODs paints an equally concerning picture. Based on my research using longitudinal data from the state of Wisconsin, I found that quarterly employment rates among ABODs were consistently below 40%, even though 2/3 of them had employment at some point in the year. This raises concerns about the ability of SNAP to support consistent and stable employment. Congress can help fix this problem by further strengthening SNAP's work requirements, including tightening the rules for waivers of ABOD work rules and evaluating work requirements in other populations. The second point I want to make relates to nutrition and health. SNAP participants display very concerning health outcomes. In a recent analysis of national health data, I found that in 2018, 65% of older SNAP adults had ever been diagnosed with diet-related disease, and 42% were obese, rates much higher than other groups of Americans not receiving SNAP. SNAP contributes to these problems because it contains no nutritional standards, and the data show that SNAP participants spend a large amount of their benefits on non-nutritious foods, such as sugary beverages and prepared desserts, which obviously contribute to poor health. There is bipartisan support to strengthen the nutrition aspects of SNAP. Congress can do this in the Farm Bill. They should make improving diet quality a core SNAP objective, require the USDA to measure diet quality among SNAP households, and track and publish the foods purchased with SNAP benefits. Congress should also establish nutrition standards in SNAP, similar to those in other federal nutrition assistance programs. Congress should also impose common sense restrictions on SNAP purchases, disallowing purchases of sugary beverages, as the National Commission on Hunger recommended doing in 2015. To close, part of SNAP's stated purpose reads the intention to raise levels of nutrition among low-income households. The new added purpose is to assist low-income adults in obtaining employment and increasing their earnings. My testimony today clearly shows that SNAP is falling short in meeting its purpose as it relates to nutrition and employment. However, Congress has an opportunity to fix its shortcomings through the Farm Bill. Thank you, and I look forward to answering your questions.
Ms. Rashidi, thank you so much for your testimony, and thank you all for your important testimony today. At this time, members will be recognized for questions in order of seniority, alternating between majority and minority members, and in order of arrival for those who joined after the hearing convened. You'll be recognized for 5 minutes each in order to allow us to get to as many questions as possible. Before I recognize myself, I ask unanimous consent to submit for the record a June 6 Forbes article about a job placement company that has been successfully connecting recipients of public assistance to employment for nearly 4 decades, entitled Work Requirements, the Ongoing Lessons of America Works. Without objection, that will be considered submitted for the record, and I will recognize myself for 5 minutes of questions. As I mentioned in my opening statement, the 4 principles that guide me as we look to address the nutrition title include innovation and technology, employment and education, integrity and accountability, and health and well-being. There are multiple programs within the Title IV, including SNAP, TFAP, and the Commodity Supplemental Food Program, each of which can benefit from some level of refinement. Mr. Hodel and Dr. Stover, can each of you provide 1 or 2 examples of where some fine-tuning can change our overall trajectory across spending, impact, and outcomes?
Thank you. In terms of fine-tuning, I like the concept of innovation, and I like the idea of thinking big, starting small. And so that's what we've done at Midwest Food Bank is looking at areas and pockets that are underserved, even through our agencies. And so I think providing support through food purchase options and also providing support just through the support of the food banks to allow them to work with the agencies that are on the ground that know the food recipients the best, partner with corporations, and partner with the food banks. The example I would use is what we're doing in the Appalachians in eastern Kentucky. We're working with corporations to purchase food. We're utilizing our volunteers as the workforce to package that food, and then an agency that's in location to distribute the food.
Mr. Chairman, if you look at the food system we have today, it was engineered to address the endpoint of hunger and food security. So all of the policies that we have, all of the programs that we have, all of the economic incentives we have are focused on that goal of limiting hunger and food insecurity. Now, because of the unintended consequence of rising healthcare costs due to the diets that we consume, there is a movement to shift to include health with hunger. To do that, I'm not sure that incremental changes will achieve that goal. If we are going to change the goal to include health, we need to rethink back across the entire agriculture value chain. Look at our incentives, look at our policies, look at our programs, look at innovations to achieve that goal. I think it may be time to rip the Band-Aid off.
Well, thanks, both of you. Ms. Royal and Dr. Rashidi, your testimony speak to issues plaguing SNAP, from skimming and burdensome regulations to labor force participation, and where nutrition programs lack accountability to the taxpayer. How do you break the logjam when talking about nutrition programs, and how do we create lasting change that results in more substantive outcomes?
Thank you for the question. I mean, I agree with Dr. Stover that, you know, when the food stamp program was first established, there was a problem of malnutrition and hunger to the extent that we do not see anymore today, fortunately, and that's a testament to SNAP. But what we have seen is this very large shift in diet quality among Americans, and I believe that SNAP has contributed to the declining diet quality. So if we think about, you know, SNAP as a program that has effectively, I think, addressed food insecurity in this country, it certainly has contributed to other problems. The main one being poor diet quality and poor health among low-income Americans, and the other being limited employment due to the disincentives that are built into the program. So I would somewhat agree that we do kind of need to shift our thinking of what the program purpose is, and it needs to be both around addressing food insecurity, but also ensuring that families have the employment and have the health that they need to live thriving lives.
Thank you. Ms. Royal?
Well, I also agree the program needs to be reexamined. I think we also need to stop ignoring the fact that fraud exists in the program. So for the 15 years that I've been aware of it, FNS continues to hold to the statistic that fraud occurs in less than 1% of SNAP. And I just find that statistic unreasonable. We do need to address integrity. We do need to make sure that the program does stay strong so it can be utilized by the families that need it. If we take I think, a more reasonable look at the fraud rate, it's still a small percentage, and I agree that. The majority of applications that we receive contain honest information and are submitted by people who need access to the program. And by all means, we should make sure that they receive it. But we also, again, cannot ignore the false applications that come in with the false statements, with the intentional acts to take benefits from the program that someone's not eligible to receive.
Thank you, Ms. Royal. My time has expired. Now recognize the ranking member for 5 minutes.
Ms. Brown, we have some startling information and statistics that I want to express to you and see if you can help us with. More than 80% of SNAP households included a child, an elderly adult, or a person with a disability. 42% of all SNAP participants were children. 16% of SNAP participants were elderly. And then USDA also found that veterans had a 7.4% greater risk of food insecurity than the general population. And veterans are characterized as having a 7.4% higher rate of living in food insecure households. So those three groups are veterans, our children, and seniors. And I might add, our seniors, basically lower income seniors, are now our most threatened group. What are we doing to try to get our hands underneath these three groups to help them become food secure? 60%, for example, of our veterans who are eligible for food assistance don't get it. What can we do to improve this situation with our children, our seniors, and our veterans?
Thank you, and agreed with the statistics that you shared. I'll start with the children. When we look, indeed, children are the majority of the population that are receiving SNAP. And parents in poverty, when they speak about the difficulties that they have, speak to a number of concerns about the difficulties that they face, and as I spoke about earlier, often go without food so that their children can go with food. And having SNAP outreach, for example, really focus in on these populations makes a really big difference in creating understanding about the availability of the program, ensuring that folks understand this is a program that is here for help when people need it. People do not want to be on SNAP, but it's here and available for people when they need it. When we think about our senior population, we know that seniors, when they receive food benefits, can stay in their homes longer. So it's so beneficial for them to receive a stable source of food. Their medication works much better. Students do better in school. We know all of the benefits that food requires in order for the health of our population to do so much better.
And let me ask you this, if I may. I mentioned in my opening remarks about the impact of artificial intelligence and our rapidly increasing technology. And I'm concerned that we are not addressing that in a proper way, because many of these job opportunities are disappearing. Artificial intelligence are doing many of these jobs, and they are being pictured to do even more of the types of jobs that lower income people who really need SNAP. What more can we do? I'm trying to get an interest here in Congress to explore this. And not only that, jobs now require being able to handle technology in terms of how they address their work. And if we're not careful, we're going to become servants of the machine that was created to serve us.
Absolutely. There's a number of ways we can work with that. Our employment and training programs, for instance, really need to address the capacity for our populations in poverty to be able to go to school and learn these skills and technologies for this new growing technology force. Additionally, we need to address the student policies to ensure that students can go to school to learn these policies, to learn this new way of working, so that they then can receive a job and move their way out of poverty. So those two areas, SNAP employment and training, strengthening, and then also reform our student policies would both be beneficial.
Thank you for your courtesy.
Sure, thank the gentleman. Before I introduce or recognize our next member, I do want to ask unanimous consent to submit for the record a June 2nd Wall Street Journal piece that shows how, by ignoring work, we are not serving low-income communities well. entitled Work Requirements and the Lost Lessons of 1996. So without objection, now recognize the other gentleman from Georgia, Mr. Austin Scott, for 5 minutes.
Thank you, Mr. Chairman. And, I absolutely support the work requirements that we have sought to add. I do want to make it clear, just so everybody understands, the change is from 49 to 54. We're not talking about senior citizens. We're talking about 49 to 54. I don't know anybody who thinks that age 54 is a senior citizen. It's not only important for them to go to work for their health, but I would remind everybody that what you earn over the course of your time, over the course of your lifetime, gets calculated into your Social Security benefits. So if you go from 49 to 54 without working, you're going to have reduced Social Security benefits the rest of your life, certainly less than you would have if you had worked. But I want to focus on what Dr. Rashidi and Dr. Stover, both of you mentioned health. And I will tell you, it bothers me as a parent. I walk in the grocery store, I see things that I buy for my family that can't be bought with SNAP benefits. And I think if we could have an honest discussion about the food that we're eating and allowing it to be purchased, that maybe we could accomplish a couple of things together instead of simply criticizing each other. But if you look at the list of things that can be purchased, fruits and vegetables, that's good. Expensive, but good. Meat, poultry, and fish, that's good. Breads and cereals, that's good. Other foods, such as snack foods, I'm not sure that's good. I'm not saying people shouldn't be able to buy a pack of crackers, but if we're honest, some of the stuff that's being bought with SNAP benefits is leading to the health challenges that you're talking about. If you go to what households cannot buy, and I'm reading from the USDA website, foods that are hot at the point of sale. So my family literally purchases a rotisserie chicken probably every week. Probably every week. It's good, it's simple, it's nutritious, and yet people can't use SNAP benefits to purchase a rotisserie chicken. I mean, can you explain to me why we won't allow people to buy a rotisserie chicken with their SNAP benefits, either of you? Why it makes any logical sense?
Well, I'll just say, I mean, the original purpose of the food stamp program was for people to purchase groceries for preparation at home. And so if you think about, at the time that food stamp program started, the idea of rotisserie chickens.
I'm talking about today. Look, I'm sorry, ma'am, respectfully, I've got 5 minutes.
Okay.
It just defies logic that we won't allow a rotisserie chicken.
The cost to prepare the rotisserie chickens are baked into the cost of that product, which is not the intention of SNAP, which is to purchase groceries for preparation at home.
It doesn't cost much more than the uncooked chicken.
I'm not going to offer an opinion, but what I will say is that we should, if we're going to have health as an outcome, we need to look at all opportunities to achieve health and balance that individual liberty versus the outcome we're interested in.
What baffles me with the whole system, my school nutrition people, we micromanage everything that our school nutrition people can serve our kids, as if that's the problem with their health, whether it be the type of milk they can drink or putting salt on asparagus or broccoli that they serve them at lunch. We micromanage everything that's done in the school cafeteria in the name of health, and yet we do nothing with regard to what we allow people to buy SNAP benefits with. So Dr. Stover, I'm going to come to you real quick. You say production agriculture is the key to human health. I think that the titles of the Farm Bill are inherently tied together. The more production ag we have, the cheaper our food supply is in this country. But I would like for you just to walk the committee through real quick the types of innovations you referenced and how they're tangible to human health.
Certainly. There are many opportunities. If you look at the Green Revolution and the technologies that were brought to bear in breeding, in processing, et cetera, to create an abundant food supply, to reduce hunger, they were incredibly successful. We need to use the same sorts of technologies. We have CRISPR, we have other innovations across the food system where we can increase both the quantity and the quality of the food that we produce that will promote health. We just need the will to do it. We need to look at barriers like regulation, like will, et cetera. But we have the tools and technology to make the food system anything we want it to be. We just have to decide what we want.
Chairman, my time's expired. I do think if we did this right, we would certainly take into account health with regard to hunger and the amount of money and where we spend it. With that, I yield.
I thank the gentleman. Now please recognize the gentleman from Massachusetts, Mr. McGovern.
Thank you, Mr. Chairman. I want to thank everybody here for their testimony, which, by the way, I read as well as listened to you here today. Some of it's been helpful. Quite frankly, some of it has not been so helpful. Ms. Royal and Ms. Rashidi, I have some strong disagreements with some of the things you have said. By the way, I would say to those who are saying we should require SNAP recipients to have healthier diets, maybe one of the things we can do is expand the benefit. You try having a healthy diet on an average of about $6 per person per day. It's awfully hard. So the benefit is inadequate, and maybe we ought to be talking about expanding GusSNP as a way to deal with that. The Speaker of the House the other day said, and I quote, he wants to get more cuts to SNAP. He wants to continue his crusade to impose more work requirements, more hurdles for people to jump through. We have people on this committee who have bills that would actually increase the age of work requirements and expand who would have to comply with them. And the Republican cuts that were in the debt ceiling bill, in my opinion, were nothing more than throwing literally hundreds of thousands of people off the benefit. They didn't get all they wanted, and because President Biden stopped them from passing the worst version of their bill, so now they want to use the Farm Bill as an excuse to kick even more people off the benefit. So, you know, the Freedom Caucus has all kinds of red lines that they're drawing that we all have to supposedly adhere to. Well, I have a red line too. You cut SNAP, you make more people in this country hungry, then we are against this Farm Bill. We will fight against this Farm Bill, plain and simple. Ms. Royal, I actually read your testimony, and your presentation here was much toned down from the testimony that you provided here today, and I would like to go through line by line to rebut some of the points that you were trying to make, but I don't have all day, only have 5 minutes. But one of the things that you say in your written testimony is you imply that the overall fraud rate, and you use Pennsylvania as an example, is something like 40%. That's just not true. You know, you're cherry-picking numbers to make it sound like fraud is rampant when it only represents a fraction of cases. Your testimony says that FNS only monitors EBT transactions for fraud, not for large retailers. Again, wrong. FNS monitors all retailers in a variety of ways, including undercover investigations and monitoring online transactions for suspicious activity. So I kind of went through that. I did my research. I got a document here that refutes a lot of what you've said, but we don't have all day. So let me just formally correct the record on one thing in your written testimony. Ms. Royal, your testimony also gives the impression that people can apply and get lots of benefits, including SNAP, with just their name, address, and a signature. Ms. Brown, help me correct the record on this. I mean, can you walk through everything people have to submit in addition to the interview, verification, and intensive quality control checks at the back end?
Thank you, Representative. Indeed, the process for application and review through our eligibility workers is quite extensive. So I'll begin to list some of the verifications. So first, a client must meet and talk to an eligibility worker, and they share information that is then verified. And that includes first, the identity of the applicant, and that can be through a driver's license, that can be through a birth certificate, and then it's a social security number. All applicants must provide a social security number. We have an automated interface in our system that matches against the Social Security Administration to verify that number. If that number is not verified, the case is closed. We also ask non-citizen applicants about if they don't have a social security number, that proof that they have applied for one, so there is a process for that. Applicants must share their proof of income, both earned and unearned, that they must submit pay stubs. They share their wage detail printout from their employers. If they've been terminated, they share documents that show their termination, the last day paid, any documents that show any type of income requirement. They also share immigration status. We match against the Systemic Alien Verification for Entitlements program to ensure that immigration status is verified. We verify residents of the state. We verify shelter. What are the shelter costs? We verify if they're a student, what are the costs of financial aid information. If they are working, we verify the number of hours that they are working, the number of counted months used in other states. And then we go through some of the deductions that they may have, whether that's medical expenses, shelter expenses, child support payments. And then once application is approved, then we go through the quality control process, which is a detailed interview with the household.
Well, that sounds like more than a name, address, and a signature. Thank you very much. I just want to say we're going to fight like hell against any cuts to this program that will increase hunger in this country. It's a wrong way for us to proceed. Thank you. I yield back.
Gentleman yields back. Before I introduce or recognize our next speaker, Dr. Desjardins, seeking unanimous consent to submit for the record a 2022 LexisNexis Risk Solutions True Cost of Fraud Study. Without objection, it's submitted, and I now please recognize Dr. Desjardins from Tennessee for 5 minutes.
I thank the chairman, and I find it interesting when we have SNAP hearings or nutrition hearings, they always seem to devolve into a partisan exercise when all of us on this committee want to prevent food insecurity, and we just have to find responsible ways to manage it, and that's what a lot of this is about. Ms. Royal, your testimony opines on the rates of fraud in SNAP, and estimates which can range from 8% to 40%. As you know, the department is set to release their error rate, a combination of overpayments and underpayments, on June 30th. What error rate is the council anticipating?
There is a significant distinguishing factor between the error rate and a fraud rate. They are independent. Again, I am a fraud investigator, but I will say that, I mean, certainly we keep track of, I'm aware of the error rate, and I do keep track of that. And I also, I'm very concerned that it's going to exceed the numbers in 2019, which were in excess of 7%.
Okay.
Again, fraud rate has to do with false statements, the number of false statements that are encountered in the program. The error rate has to do with the accuracy that states issue benefits.
Okay. You speak in your testimony about the importance of integrity in our nation's public assistance programs. One concern of mine has been the number of non-citizens who are receiving benefits. You may be aware that there are 13 categories outlining eligibility requirements for benefits with no waiting period, and this includes qualified alien children under 18 years of age and asylees under Section 8 of the Immigration and Nationality Act. I firmly believe SNAP was intended to temporarily serve American families, giving them a leg up they need to be self-sufficient. And SNAP is already projected to cost more than $1.2 trillion over the next 2 years. And with the crisis we've seen at the southern border, with literally millions of undocumented citizens coming in, I don't think the program can continue to keep up, considering that there's literally millions of children that qualify for SNAP based on these standards, and also the fact that almost everyone coming across the border is seeking asylum. Do you have any ideas about how do we maintain the program integrity when it comes to non-citizens?
Critical element that we need is identity verification at the front end. So when somebody submits an application, we have the ability, again, to verify that the person is who that they say that they are. Certainly, benefits can be issued with a name, address, and signature. Verification is required to continue benefits, but the name, address, signature is the requirement on the initial benefit. Having technology available at the beginning to leverage that verification process, to leverage all of the facets of eligibility, would be a game-changing opportunity for the fight for integrity.
Mr. Earl, I'm certain you're aware the National Accuracy Clearinghouse, as written in the 2018 Farm Bill, has yet to be implemented due to a variety of executive branch antics. At this point, we're looking at another 5 years before the NAC is fully implemented, and I'm not convinced it will resemble anything like the policymakers designed. Do you have any thoughts on this?
That was a devastating blow to SNAP integrity. The National Accuracy Clearinghouse just provided an opportunity for states to discover whether an individual receiving benefits in more than one state at one time. That isn't always an intentional error. Somebody can cross state lines and inadvertently forget to close their previous case, submit an application. That does happen. And the NAC would have given us the tool to identify that. Unfortunately, it's also an opportunity for people to steal from the program. People do submit applications across state lines with the intentional act to receive dual benefits. That also, the NAC would have been able to help us identify those intentional acts as well. The delay, again, was devastating to integrity. Having the new NAC, if you will, developed and able to roll out in the next 5 years at the end of 2027 can cost the taxpayers billions of dollars.
Well, thank you all for being here today. My time is about to expire. Mr. Chairman, I yield back.
Chair now recognizes Ms. Adams from North Carolina for 5 minutes.
Thank you, Mr. Chairman, and thank you all for your testimony. You know, I just keep hearing all this fear-mongering. It's just wrong. Undocumented individuals are not eligible for SNAP, and no American citizen is being denied SNAP because a permanent resident received benefits. And no one in this country should go hungry because they can't afford food, period. I strongly believe that, and that's why I am still furious that Speaker McCarthy and House Republicans held the American economy hostage to make our lowest income Americans pay the price by taking food off their tables for their tax breaks for the richest 1%. It's kind of like Robin Hood in reverse. We're taking food from the poorest of the poor, we're blaming them for the debt, and we're asking nothing of the richest of the rich. Now, poor folk are not responsible for our debt, and you shouldn't be punished because you're poor. So when I heard that my colleagues, including the Speaker, are going to push to take food assistance away from more vulnerable Americans in the upcoming Farm Bill, we're just not going to have that. No more PPP, punishing poor people. You know, there are more than 2,000 references in the Bible that speak to how we treat the poor. And so what's being proposed, that's not the way, that's not what it says. Our ranking member has previously stated, taking food away from people is unchristian. Well, so is all of the misinformation and the conspiracy about SNAP. Leviticus 19 and 11 reminds us, do not steal, do not lie. And so I'm not going to support any farm bill or any other legislation that will take food away from low-income households, which are really underpaid households. And we continue to talk about getting to work for $7.25 an hour. You can't survive on $7.25. Cuts to SNAP harm our nation's most vulnerable, including children and families and older Americans and disabled people. In 2020, almost 31,000 households in my district depended on SNAP to put food on their tables every month. We have a food insecurity issue in North Carolina and in other places. So soon, many low-income Americans will lose out on critical food assistance because the reinstatement of SNAP's punitive, insensitive 3-month time limit on benefits for people who can't find work but who need to eat. So where's the compassion, folks? You know, taking away SNAP doesn't help anyone find work. It just makes them go hungry. Our SNAP recipients who can work, do work, and some people, like elderly people, are being forced to work in our economy. I've heard stories about people in my district taking low-wage jobs when they should be enjoying retirement, for example, and some of them can't even stand up at work, greeting people, coming into the store. Many of these folks that we're trying to punish here get SNAP benefits because they don't earn enough. The money runs out, the food runs out before the month runs out. Working hard is not enough if you don't make enough. $7.25, you can't survive. And all of my colleagues here know it. And then when we talk about what you're getting, $6 a day, $2.41, I mean, come on. Are you going to be able to eat a decent meal for $2.41 a meal? That is absolutely ridiculous. Ms. Brown, how is Minnesota preparing to reinstate the time limit and the expansion to 50 to 54 years old. By the way, I got my AARP card at 50, so some people do consider you to be a senior then. So what burden does the time limit place on program administrators and recipients, and what do you think the ultimate impact will be?
Thank you, Representative. The time limit, so as we are thinking about reinstating the time limits, we're working through a number of processes. We're ensuring that our trainers, our workers are fully trained and are aware of the rules and regulations they need to apply on people. We're working with recipients to ensure that they are aware of what they need to do to keep up to speed with the changing regulation. We're ensuring that our websites have information about other resources that they can access. So we know this will be an additional burden on our food banks and our food shelf system, which is already seeing record numbers. So we're preparing in a lot of ways with our emergency food system to ensure that folks are ready to respond to the number of folks that will no longer be available. We also are working to ensure that we can apply for a waiver that will allow us to take into consideration the unemployment rates. So we know, and as I shared earlier, that our unemployment rate in Minnesota is very low. But when we start to look at the racial divides, we see that African American and American Indian populations are disproportionately impacted. And so this time limit will disproportionately impact those populations.
Thank you very much, ma'am. My time is up. We're not going to allow this. I want my colleagues to know that. Let's keep SNAP. Let's keep people eating. We must feed folks. Working hard is not enough if you don't make enough.
Thank you. Chair asks unanimous consent to submit for the record May 31st Fox Business article referencing April surge in job openings. Job openings unexpectedly surge in April to the highest level in 3 months. Here are no objections. It is submitted. I now recognize Mr. Lamalfa for 5 minutes.
Thank you, Mr. Chairman. We keep hearing we're not going to allow this or that. Well, all we're looking for here is a program that's being run with accuracy and integrity for the folks that have the real need that are receiving it, and that there's also it's appropriate to have course corrections with any federal program and during its time of existence. So tired of these accusations. So Ms. Royal, I want to clarify something that was said earlier as well, is that are not asylum seekers and any person under 18 years old able to receive SNAP benefits in this country as non-citizens? Anybody else on the panel would want to weigh in on that? Ms. Royal, is that something you're aware of?
It's not something I'm comfortable in responding to. Again, I'm an integrity investigator, and I don't issue benefits.
Okay, how about Ms. Rashidi, Dr. Rashidi?
I do not believe the 5-year ban on non-citizen applies to asylums.
Sorry?
So there's a 5-year ban on non-citizens that they can't receive SNAP benefits. I do not believe that applies to those that are seeking asylum.
No, it does not apply to asylum. How about under 18-year-old?
And children as well, right?
Yeah, so we do have people that are not here legally that are receiving SNAP benefits, or that are not citizens receiving SNAP benefits.
Right, I mean, I think they're here legally if they're seeking asylum, but yes.
No, asylum's one thing, but people under 18 that have gotten here are receiving SNAP benefits,
That's your
right?
point, yes.
Okay, thank you. So, Dr. Stover, we're hearing about the gap in income and how far that goes on receiving nutritious food, healthier choices. So would increasing the dollar amount of the benefits, would that lead to healthier choices, do you believe? And do you have any data that would support that?
There are data in this area. What I would say to that is if one is interested in increasing the SNAP benefit for a health outcome, one would look at the available data to do an impact analysis and look over time, what has increasing SNAP done to affect hunger and food insecurity? What could increasing the SNAP benefit do to then improve health outcomes and lower health care costs? But that is the type of data that we need so we can have science-informed and data-driven policies. So while not answering that question directly because I'm not familiar with the totality of the literature, this is the value of having an evidence-based approach to setting policy so that one can be certain about outcomes, or more certain about outcomes.
So in all the time, the existence of the SNAP program, we don't really have data that's been gathered yet that a increased dollar amount per user of the program would lead to healthier food choices in their diet.
Some of those data are available, and we can make those available to you, but I don't have those at my fingertips.
Do you have a conclusion from what you know of that data that would say, yes, it seems true, or inconclusive? What do you think about the data you've seen?
I am not aware of any meta-analyses or any type of research synthesis that has been done to look at the totality of the literature. There are some studies that show effects, there are some studies that show other effects, but I am not aware of someone who has systematically combined all of the data to answer your specific question, but I agree with you that that is what is needed in the entire food and agriculture space.
More data or higher benefits?
More data and combination of the data. Looking at the existing data and combining it in a way that is statistically appropriate so that you can get the answer you're seeking so you can make an informed decision.
So in all these years, we don't have this kind of data that's being gathered, so we've got more to do on data gathering. So, all right. So the concept that's been advanced today is that more money would mean healthier choices. We don't really have proof of that.
I am totality of the literature that would.
All right. All right. Do you have an idea of what we could do to incentivize healthier choices, whether it's more dollars or any other method? And we have just a little time, please.
Again, the food system we have is focused on lowering rates of hunger and food insecurity. If you change the endpoint to health, then all of your incentives should be around health, not around the food itself.
Okay, thank you.
Gentleman's time's expired. I ask to submit for the record a February 2023 article on how SNAP can be strengthened to be a health intervention. Without objection, so ordered. Ms. Hayes, from Connecticut, you're recognized for 5 minutes.
Thank you. And thank you for holding this hearing. Much of our work this year is going to be around the Farm Bill, and we've heard a lot about how the Farm Bill impacts farmers and rural communities. While every member of Congress may not represent a rural community, I remind you that every single one of us represents people who eat. And with the Farm Bill being our biggest undertaking, I will once again express my disappointment that 80% of the Farm Bill falls under the nutrition title, and this is the first and only hearing we are having on this topic. You are all right. Hunger should not be a political issue. But when we came to the table to negotiate on the debt ceiling, what my Republican colleagues asked for was increases to our military budget, which has been increased year after year, even though the DOD has failed 5 consecutive waste, fraud, and abuse audits, and they are unable to account for over 60% of their $3.5 trillion in assets. But SNAP is where we want to look to make cuts. Their obsession with cutting food assistance is just jarring. I remind you one more time, $6 per person per day. That is not the cause of our enormous budget deficits. And highlighting one-off instances of fraud as indicative of the larger program is just wrong. Ms. Royale, I hope that you arrest every single person who is committing fraud in the SNAP program because they too are stealing from the people who need it most. Every one of us supports investigating those cases of fraud, which are few and far between and not what is being reported today. SNAP is one of the largest anti-hunger, anti-poverty initiatives in this nation. More than 42 million Americans depend on SNAP each month, including 15.3 million children. 108,000 of those children live in my state. And when we want to talk about data, I listened very carefully to some of the data that Mrs. Rashidi introduced. Federal data shows that 4 out of 5 households in the program have at least one family member working. So the majority of people who are collecting benefits are working. As an educator, I saw poverty firsthand. hungry kids don't learn. And hunger and poverty is a significant driver to poor learning outcomes, and many families are unable to purchase or access the food their children need to reach their full potential. I'm going to go through all of this, and then I'm going to give you some time, Ms. Tiki Brown, to respond. I want you to talk about the effects hunger has on learning and how these can be lifelong and cyclical, and what barriers children have to accessing SNAP. And then my other question, I just want you to have enough time to speak, is about incentive programs like GusSNP and how they help SNAP recipients purchase fruits and vegetables and support local farmers. We heard a lot about people's choices. Their choices are not because they don't have restrictions or guidelines in SNAP. Many low-income, urban, and rural communities frequently have low access to healthy food or retail options. If there's no grocery store around you and you're buying your meals from a bodega and you're homeless and don't have access to hot foods, you buy what's available. So it is flawed to think that people are just making the choice from everything there to only buy snacks. So my second question that I'd like for you to address, Ms. Brown, is how programs like GusSNP can help connect people in low-access communities to farmers markets, and healthy food options. So those two things, thank you.
Thank you, Representative. So to your first question, absolutely. Children who go to school hungry, who live in households with a lack of access to food, often suffer with an inability to concentrate at school. They fall behind academically. They're more likely to miss school because of illnesses. It impacts health, right? And we see those impacts throughout a person's life often as well. So prevention is key here in ensuring that children have enough food from an early age and throughout their growth cycle. To your second question around incentives, it's incredibly important. In Minnesota, we have been able to pay with state dollars through our legislature a market bucks program, and that incentivizes SNAP recipients by doubling their SNAP dollars at the farmer's market. It creates more access to fruits and vegetables. It helps rural farmer markets and agriculture producers. It's an absolutely wonderful program, and people enjoy it. So we have to think about when we are talking about SNAP participants, it's a supplemental program. It's $110 per month in our state, and it does not cover every single expense. And so when we look at what people are buying, we have to consider all of the options. Thank you.
Thank you. With that, I yield back.
Thank you, Chair. And I recognize Mr. Bost for 5 minutes.
Thank you, Mr. Chair. My colleagues from the other side of the aisle did a couple things here. First off, one said that we only had one hearing, but while they were in the majority, they only had 2 on this. You know that? But since 2015, we've had 39 on this particular subject. One of my colleagues also on the other side of the aisle gave testimony that one of our witnesses has failed to allow, blew apart and complained about her testimony, but failed to allow her to respond. And I'd like to give Ms. Royal a moment, if she can, to respond about her testimony and why it is accurate.
The accusation was that it requires more than name, address, and signature to submit an application. And to make the clarification, that is what's required to receive an application. Now, verification is required of the different things that, among the different things that Ms. Brown described. And that verification, the burden of that falls on the agency to do that. So somebody comes in, essentially John Doe, homeless, and puts an X on the application, it needs to be processed, and benefits are likely going to be issued for that first month. I'll clarify again. We will need to get clarifying information according to the regulations, including Social Security number and additional eligibility requirements. But I'll hold fast to that statement as true and accurate.
Thank you very much. Mr. Hodel, we're spending more taxpayer dollars on nutrition support than ever before, yet the rate of food insecurity still hovers around 10%. Where is innovation lacking, and where do you see opportunities, where do they lie for new ways to invest these programs so they show results and decrease the rates of food insecurity. If any other witnesses would like to add to that, I'd like that as well. So,
Thank you, Representative. Yeah, innovation, you go to any corporation, I mean, that's the buzzword, but it's elusive. Innovation starts with ideas, and ideas start with people. And the secret sauce at Midwest Food Bank is our volunteers. We have 30,000 volunteers that come in and out of our facilities every year. And we highly leverage our volunteers in a variety of roles. And so that's what sparks our ideas for innovation. So we're blessed at Midwest Food Bank to have a variety of talents. They're retirees, they're still employed, they're mothers that are looking to kind of fill their day, but they all bring different life experiences. They all bring different education to Midwest Food Bank, and that sparks ideas. And so from those ideas, then we move quickly. We experiment, we determine what works, and we just grow from there. And so I would say that innovation of how do we use companies that have logistics companies and we utilize their freight lanes? How are they distributing family food boxes for us? Where are we working with the retail market and the grocery industry has changed rapidly, and so we have to pivot quickly to rescue food. And so all of those ideas and connections to make sure that we're casting a broad net, we're rescuing food across the country, we're bringing it in, and a lot of times using other resources, companies that have trucking companies that are willing to give back and support philanthropically to what Midwest Food Bank does. One other example of innovation is we have a local junior college that they train their CDL drivers at our facility. We have a large parking lot, and so we get food moved around by that junior college while they're achieving their CDL certification.
wonderful. Anyone else?
Can I just add real quickly that there is a disconnect between food insecurity rates and SNAP expenditures, and we've seen that even more so in recent years. Since 2019, over $40 billion more dollars in SNAP has gone out to households in real dollars. Benefits were increased in 2021 by 25%, and we have not really seen food insecurity rates move very much.
I'd just like to add that I really appreciate the innovation that we've seen here with the Midwest Food Bank. As was said, rates of hunger and food insecurity, other than the pandemic, have been pretty much stagnant. And the issue is not food production, it's access. And dealing with the access issue was absolutely critical. At the same time, we've also seen, amongst that population, rapid increases in obesity and diet-related chronic disease. And so it's access, but we also need to have to think about the issue of the chronic diseases in that population.
Thank you very much for all of you for your answers. Let me be very, very clear here. No Republican wants to see people go hungry. We want to make sure a program works. But the difference is we want to make sure that it works wisely. That it works wisely and we're spending the money accurately. And my time has expired, but I think if you want me to, I can go on a long time explaining why it is that the program itself has a lot of problems. With that, Mr. Chairman, I yield back.
To clarify, in the first 6 months of the 117th, this committee had 2 meetings on production agriculture, and so far we've had 1 on production agriculture. So that's, I know there's some accusations going back and forth, but it's, anyway. And
yeah, Mr. Chairman,
yes, sir.
I want to ask unanimous consent to insert in the record an article entitled City Slickers Receiving Federal Farm Subsidies Soared Under Trump, and it basically is about a GAO study that found that roughly 1/4 of farm subsidy recipients do not contribute personal labor to farms. They live in urban areas like New York City and Chicago. So we want to talk about integrity of programs and cracking down on fraud. Maybe we ought to do a hearing on this rather than beating up on poor people.
So ordered. We can't make a speech on it. We're going to allow you to submit it for the record. All right, Ms. Brown. From Ohio, 5 minutes.
Thank you so much. As we open with prayer, I am reminded of Proverbs 14:31. Whoever oppresses a poor man insults his maker, but he who is generous to the needy honors him. Last Congress, we held 7 hearings on nutrition, so I want to set the record straight on that. I also want to set the record straight as it relates to illegals or aliens that are getting SNAP. This is, again, pure fear-mongering and wrong on many levels. 1, undocumented individuals are not eligible for SNAP. 2, SNAP benefits are available to all who qualify, and no American citizen is being denied SNAP because a permanent resident received benefits. More than 96% of SNAP participants are U.S. citizens. Of the 4% who are not, less than 1% are refugees and 3% are lawful permanent residents and other eligible non-citizens like asylees. And they are only eligible once they have been granted asylum, not while their applications are pending. The only exception is for Cuban and Haitian nationals. So I just, again, want to set the record straight. As it relates to incentivizing nutrition, nutrition incentives are definitely a benefit, and we can talk about programs like GusNIP, which are far more effective and productive, and I'm happy to discuss how we can work together to expand that program, because in my district, almost 25% of households, which nearly 1 in 4, depend on SNAP to put food on their tables. Statewide, in my state, 1.3 million Ohioans receive food assistance through SNAP. In an average month, this number includes 530,000 children, 200,000 individuals with disabilities, and 163,000 seniors, however you want to define them. One of the most vulnerable food insecure populations in my district, and indeed across the nation, are people facing homelessness. Even though most, if not all of these people are SNAP eligible, our homeless population has lower SNAP enrollment rates than any other groups due to administrative and logistical barriers like inconsistent transportation and lack of access to food storage and preparations, Ms. Royal. They also face obstacles to employment such as a consistent address and access to a phone, email, or traditional mail. That is why I remain outraged that the Republicans demanded more older Americans be subject to SNAP's harsh time limits on benefits as part of the debt limit agreement. I was pleased, though, that President Biden was able to negotiate a new exemption for individuals experiencing homelessness through 2030. Leaving people hungry will not help our economy. It will not create jobs or balance the budget. But despite these claims, this is what my Republican colleagues seem to believe. So, Ms. Brown, no relation, I don't think. As things currently stand, pre-implementation of the new exemption, how do work requirements impact homeless individuals? And what are some of the barriers unhoused populations face to achieve steady work?
Thank you, Representative. So currently in our state, we do use a exemption with our homeless population. We call it a homeless plus. So if somebody is lacking in a fixed or regular nighttime residence, plus they are lacking access to a shower or laundry facilities, they can achieve some exemption. So we have made some progress in that front. What we found in speaking to the population is that they find it very difficult to interview for jobs, and people, in fact, will not interview with them if they do not have access to a shower or have access to laundry facilities. So I also want to just make the comment that some homeless individuals do work. And they also face many, many barriers. When people are homeless, they often have to check into a homeless shelter at a certain time of the night or even during the day, and that does impede their ability to work and to go to interviews. And so there are a number of barriers that homeless individuals face that prevent them from achieving long-lasting work, and that is why SNAP is so important to ensure that they have the ability to have food so that they then can stabilize.
2 questions. Do you think the exemption will help more unhoused individuals qualify and stay qualified for SNAP? And if so, should we consider making this a permanent exemption?
I think it's a great opportunity for folks. I believe that it will allow folks to stay on the program longer to stabilize.
Thank you. So I want to be clear, as we begin serious consideration of the upcoming Farm Bill, I will not support taking food assistance away from low-income households, period. And with that, Mr. Chairman, I yield back the balance of my time.
Thank you, Mr. Chairman. I appreciate the witnesses being here today. 4 out of every $5 in the Farm Bill goes to nutrition as it stands today, and that worries me. I would like to take this opportunity to remind my friends across the aisle that this Farm Bill is not a nutrition bill, and that there is more to be discussed than just SNAP programming. Do I think hungry people should go? No. Did I think people should go hungry? No. Absolutely not. But I do think we need to make sure the program that's consuming more than 85% of the Farm Bill's budget needs to ensure it needs to be administered in a way that serves the taxpayers and for those receiving those benefits. I want to make sure that we talk about integrity and innovation in this hearing session. And so, one of the things I want to ask Ms. Royal, I know if you've been tracking the federal welfare program reforms and the new debt ceiling negotiations, how do you expect other provisions in the debt ceiling package to increase program transparency and integrity?
I'm not aware of elements in the new debt ceiling package that are going to affect integrity. Again, integrity has to do with intentional false statements that people make in order to become eligible. And the focus, again, on pursuing fraud in that program, I would say is confined to that area.
I grew up on a farm and worked in industry before I actually came to Congress, and I can certainly appreciate the value of a hard day's work. The SNAP program has education and training requirements included in its eligibility standards. Dr. Rashidi, can you speak to the value of incorporating education and training opportunities into SNAP eligibility standards, and have these requirements shown a return to the workforce and self-sufficiency?
Well, the SNAP Employment and Training Program is largely voluntary in most states. There's a few that have mandatory for ABODs, but for the most part, it's voluntary. The funding is also fairly limited. There's a state match that's required, so really this program is pretty small. And the evidence that we have on the programs, again, that's people already motivated to participate because it's voluntary, they participate. The evidence that we have is these programs are actually not very effective at increasing employment on average. And so I think there's a lot of work that could be done because employment and training is a key component, and the program could be stronger in that area.
Dr. Rashidi, I don't think there's a government program in the world as good as a job. And I think people earning and working, I think that's shown even with the Clinton work requirements when they came out with those under Bill Clinton, that once people got in the workforce, they stayed in the workforce, and it actually improved their standard of living. And so, I think that's something we should all encourage and want to see. I don't think that programs should be, there's safety net programs, but they should not be spider webs. I don't think people should get trapped in those programs. I think our job is to lift people out of poverty and then create opportunity for those folks. And so, Ms. Brown, I'm trying to promote you to PhD here. Quick question. You said something a while ago about people applying maybe for benefits that maybe are non-citizens. And do you know if asylee seekies, if they're the people who are seeking asylum instantly are approved for benefits?
Thank you, Representative. Asylee seekers do not receive benefits. Once they receive asylum, then they would be eligible.
Do you know how quickly that process happens normally when they apply for asylum?
I unfortunately do not.
Okay, in Yuma, Arizona, I went to a hearing down there a few weeks ago, and we were actually interviewing some law enforcement officers and people down along the border in Yuma. And one of the things that concerned me was the sheriff told me that instantly when those people cross the border, they've granted a notice to appear in court, and they're given benefits, taxpayer benefits. And so my concern was we know of 5 million people now that have had encounters on the southern border, but one of the things is they're throwing their IDs down before they get there. So we have tons of IDs south of the U.S. border, and people are claiming to be unaccompanied minors, but they're above the age of 18. And so my concern for the American people, that we want, the people that are most vulnerable, we talk about the vulnerable populations in this country, my concern is if we continue to just process 5 million people every 24 months at the U.S. southern border, that at some point the people on our assistance programs will push out the most needy Americans. And that's a concern for me, because when they told me instantly they got a cell phone, and then they got a notice to appear in court, and in many cases they got benefits of up to $800 a month. And that's concerning for me, because I'm afraid some of that might be SNAP benefits that we could be using for Americans. So I just wondered if you might have any access or idea of how quickly they're approved, and how are we verifying? You said something I thought was interesting, a proof of application for a Social Security number. Could you elaborate on, never mind.
Ms. Brown, could you be very fast with that? We're out of time.
Real quick, Ms. Brown, please.
We do have a number of verifications that ensure that Social Security number, you cannot receive benefits without a Social Security number.
Okay. All right. Chair, time expired. Before we go to Ms. Davids for 5 minutes, Mr. Finstead, we're coming to you next. Ms. Davids, 5 minutes.
Good morning. Being in Congress can be hard sometimes because it's kind of heartbreaking. To spend so much time trying to get here, to have arguments that include sometimes, while focusing on trying to make sure that we have integrity in a system, or that we are taking care of American citizens, that we sometimes end up seeing the dehumanization of people. And as someone who grew up poor and has managed to, through education, through help from a lot of different people and organizations, to have conversations taking place that essentially start with a premise of laziness or a lack of desire to do something like get an education or get a job. Because people who aren't able to feed their kids are not sitting at home trying to figure out how to avoid getting a job. And I just really hope that we can have conversations where we're not acting like people who want to feed their kids or even bring their kids here so they can work and have access to better lives, are trying to do something negative. I have notes. So as our committee engages in serious discussions about the upcoming Farm Bill, oh no, I'm having a fly moment. Good, that was the break I needed. As we begin to engage in serious discussions about the upcoming Farm Bill, I do want to emphasize that I am personally committed to ensuring that we pass a Farm Bill that both supports our farmers and producers and also protects food security for America's households, low-income households, rural communities, our veterans, children, families, seniors. And beyond its immediate impacts on food security, SNAP is a critical economic driver, especially in rural communities. In Kansas, where I live, an average of $21 million in SNAP assistance was issued each month in the fiscal year 2020. The utilization of SNAP is an investment in our communities by helping low-income families afford food and ensuring that farmers, processors, distributors, and retailers are also able to be supported. And as of 2020, we had about 2,000 food retailers accepting SNAP in Kansas. And a nationwide study by the National Grocers Association found that in 2020, SNAP was responsible for more than 200,000 U.S. grocery jobs, earning wages totaling more than $6.7 billion. I know that USDA's Economic Research Service has also found that during economic downturns, $1 utilized in SNAP generates more than $1.50 in economic activity. And I had questions that I wanted to ask, but the last thing I want to say, just speaking to this, is I've lived in a rural community where it took 35 minutes to get to a grocery store that often couldn't sell meat because they kept getting cited by regulators. And the next closest place was a Dollar General. And that was 48 minutes. And the next closest place was a super Walmart that was 90 minutes from the town I lived in. And I just know that when we're making these policies, none of us knows every single person's experience, but all of us should be trying to figure out how we make sure that people can eat, have jobs, feel secure, and and not be dehumanized. And I think we can do all of that together. I'll yield back.
Chair now recognizes Mr. Finstead for 5 minutes.
Thank you, Mr. Chairman, and thank you, Ranking Member Scott, for holding this important hearing today, and thank you to all of our witnesses for being here. And I'll just start my comments out by maybe acknowledging what I've heard a little bit from the folks on the other side of the aisle here, and I will just simply say, I hear you. And one party in this country doesn't own compassion, and one party in this country doesn't own the willingness to give the shirt off your back for your neighbors that are in need. I think that is something that we all can agree that we can work together on and that we can hold as a common value. And I will just say that we can do that, but we can also talk about serious things like program integrity and making sure that we are getting the best bang for the buck, that the taxpayers' dollars are going to those most vulnerable people. That should be something, again, that we on both sides of the aisle could agree on. So I think there is some common ground here, and it's so important that we keep this conversation going and that we keep the bipartisan nature of a Farm Bill coalition intact, because it's going to take that to get this done. In 2001, we spent $17 billion on SNAP. This year, SNAP is projected to cost taxpayers $124 billion, an increase of over 700%. Meanwhile, food insecurity in this country has remained largely unchanged. So I think that's some data that's important for us to know, that it is not because of a lack of investment. We have definitely put our money where our mouth is in this country. So as we explore the conversation in regards to program integrity and trying to make sure that we understand, are we getting the dollars to those that are in the most need? A couple things that come to mind that I need maybe just to better understand. So I'll start with Ms. Royal. Americans in rural communities I represent, again, like I've said, would clearly give the shirt off their back to help a neighbor in need. And really our Southern Minnesota philosophy is, we're all about giving folks a hand up, not just a handout. How do we help people get to that next level of life? And we're willing to do it. So in your testimony today, you referenced the rates of fraud in SNAP. But you also mentioned a little bit about the error rate. And I just want to maybe have you give us a quick view of what's error rate versus fraud. If you could do that, Ms. Royal.
Error rate comes from quality control reviews that are done, are mandated and done by each state, and it checks the accuracy of benefits that are issued by the state. The fraud rate is the amount of fraud that occurs in the program. The error rate is calculated and reported, but the fraud rate is really difficult to put your finger on because there are so many different elements that make up that rate. So states do report quarterly on our fraud, but they use a form, it's the 366B form. It's antiquated, it's inaccurate. It provides just not even a snapshot, but an excerpt of information that states have to deal with in regards to fraud.
Thank you for that. And, just I'm a simple farmer from Southern Minnesota. Error rate, fraud rate, to me, it all is dollars that aren't going to where we said we want them to go. And that's to help the most vulnerable people in this country, whether it's error rate or fraud rate. And I think it's something that we have to, again, this is it should be a bipartisan concern and an issue. And if we're focused on getting dollars to the most vulnerable, this is a way to make sure we can get more money to the most vulnerable. So I appreciate helping me understand that a little bit better. Dr. Rashidi, in your testimony, you reflected on waivers, something that has long seen strong support from one side and intense opposition from the other side. While I'm sure there'll be further debate on this, I'd like to take a step back and talk about the role of the states. This is an administered program by the states, and it's such an important part of this. So this administration reissued an Obama-era guidance that reiterated the importance of states screening recipients for the able-bodied adult work requirements. When a state is waived, recipients lose a touch point, one that could have connected them to other services or other supports, well beyond work. Would you share your thoughts on this issue, Dr. Rashidi?
Yes, thank you for the question. And I think this is an important point because the problem with SNAP related to employment is not related to the individuals. The problem is related to the program and the way the program is set up. I interacted with hundreds of SNAP participants throughout my tenure as Deputy Commissioner in New York City. The vast majority of them want to work, but they are frustrated that this program holds them back. And so by waiving work requirements, it's exactly what you said. You're removing a touch point. I don't think it's at all compassionate to send government checks to households and that leaves them jobless and in poor health and not have a touch point with a government worker who is trying to help them. And I think that the approach of ignoring the issues in the households and just sending them checks in the name of reducing hunger is not the right approach.
Gentleman's time has expired. I seek unanimous consent to enter into the record 7 CFR 1400, a regulation promulgated by Secretary Vilsack in 2015 regarding the actively engaged in farming requirements. This regulation requires any producer receiving farm program payments to make a significant contribution of active personal labor management and have a share of the risk of the farm operation. This regulation ensures that no one gets assistance unless they have significant involvement in the operation of the farm. That said, I now recognize Ms. Caraveo of Colorado for 5 minutes.
Thank you, Mr. Chair, and I'd like to thank Chairman Thompson and Ranking Member Scott for hosting today's incredibly important hearing on nutrition, and thank you for the panel for being here and sharing your testimony. I'm a pediatrician, and as a pediatrician, I am very passionate about the health and well-being of our nation's children. When we talk about the front lines, I have been on the front lines of taking care of children's medical needs for the last 15 years while dealing with their food insecurity and being able to do little as a pediatrician other than tell them that there is a supplemental program to help them with their hunger needs. That is why I will not support any changes in the Farm Bill that will take food away from low-income households, which would harm our nation's children and families, including the ones that I saw in clinic every single day. I am deeply concerned about the proposals being pushed by Republicans that would put food assistance for more than 4 million children and 3 million parents, grandparents, and other caretakers at risk. Let's take a step back and talk about why this is so important. Many people do not know that 42% of SNAP participants are children. That's 15.3 million children in the country. And in my home state of Colorado alone, nearly 180,000 kids who participate in SNAP each month. Now, I understand that my colleagues on the other side of the aisle have said that they don't want to put anybody at risk of hunger, in particular children. But when we make cuts to programs, they affect the kids that I see in clinic every single day. Now, about 80 children a week is what I saw in clinic every single week. About 2/3 of those kids were on Medicaid, and therefore a good portion of them were on SNAP. So let's round that out and say about 50 kids a week, every single week, who I saw who relied on this benefit to make sure that they did not go into hunger. When we talk about cuts, we're talking about pediatricians having serious conversations with families about hunger. I stop and think, which of those 50 kids, which of those 50 families would I have to stop and say, sorry, you don't get these benefits anymore? Should it be the family of 4 kids who are now being raised by their grandparents because their parents have been victims to the opioid crisis, and now these parents, instead of thinking of retirement, are focusing on how am I going to feed these kids? Thank God for SNAP. Should it be the single parent who's trying to balance childcare, having a job or two, and still not making ends meet, and therefore says, thank God for SNAP, at least my kids are going to be fed every single day? Should it be the family, the nuclear family that we think is doing everything right, yet is still living below the poverty line and says, thank God for SNAP, at least I have $6 extra per kid per day to put something on the table? Now, people don't always think of pediatricians having to have these difficult conversations, but they do think of us talking about the science. So let's talk about science. Research shows that not having enough resources to meet children's basic needs leads to a host of negative outcomes throughout a child's life, including poorer health and lower educational achievement. There's tons of issues really around children's health, whether it is including the risk of obesity, high blood pressure, heart disease and diabetes in adulthood that comes from hunger and food instability, but is addressed by SNAP. But Ms. Brown, what I would like to hear from you is, I've talked about the families that I've seen in clinic and how SNAP impacts them. Can you tell me more about the families that you've seen with children? How would additional investments in SNAP make this program even more effective and impactful on the health of kids in your state and mine?
Thank you very much for the question. We hear from families who talk about the mental health toll on themselves and on their children. We know that with research that we have from Chapin Hall out of Chicago, they talk about the connection between family stability and food security helping mitigate child protection cases. So we know there are connections to other programs and other negative impacts on children, on families. We hear from families that are very excited to have a little bit of food to buy bananas and milk. That's a number, those are the top two things that our retailers tell us that families on SNAP buy. So those small things make a really big difference in people's lives. I also just want to make a quick note that, we've heard a little bit about food insecurity rates have not decreased despite all of the extra funding being brought into the program. That's exactly what it's supposed to do. With all of the extra funding being put in, food insecurity rates did not decrease, they stayed the same. That's exactly what SNAP is supposed to do.
Thank you so much for those comments, and I just urge my colleagues to think about when you make cuts, which of those 50 children would you choose to cut benefits from? Thank you.
Chair, and I recognize Mr. Bacon for 5 minutes.
Thank you, Mr. Austin. Thanks for all of our panelists being here today. The evidence is very clear. The majority of Americans think able-bodied adults without children should have to work or seek work or get the training to get a job. And it's not even close. We had a poll just a month ago from Axios saying 2/3 of Americans support work requirements to include half of all Democrats. A poll a month before that from the Center of Excellence poll showed 74% of Americans support work requirements to include the majority of Democrats. So again, we're talking about able-bodied adults without children. And we have record low unemployment. We have a record number of people trying to hire. And we have lots of opportunities for folks to get the skills and the training they need to get these jobs. This is very important to the America's economy and our economic growth. My first question is to Dr. Rashidi. We hear from those, and this is in the previous Congress, that those that have been on SNAP, there's a point where they earn one more dollar that they could lose hundreds of dollars of benefits. We call it the cliff effect. And sometimes this is a disincentive for full-time work or promotions. I would like to get your opinion on this. We've heard experts in this committee say this, but I'm curious to get your perception and your feedback.
Yes, it's a great question. Benefit cliffs, or we also call it marginal effective tax rates because it actually kind of phases out over time, is an issue. And if you talk to state administrators or state groups who work with SNAP participants, it really is one of the number one issues because it does disincentivize employment because people feel that they can't increase their work effort or increase hours because they will lose some of their benefits. One way to counteract that is to phase out the benefits more slowly. SNAP currently is phased out, but there are some additional things that could be done to try to smooth that benefit decrease as earnings increase.
We'd sure like to have your expertise so we could do this better because we want to incentivize promotions, full-time work, but to ask someone that's in a lower income area to say, okay, if I get this promotion, I'm actually going backwards. It's not advantageous. I know we could do better. I think with that, I'll yield back the balance of my time. I appreciate all of you being here today.
Chair now recognizes Ms. Glusenkamp-Perez for 5 minutes.
Good luck with that one. Thank you. Thank you, Mr. Chair.
That's about as good as a Georgia boy can do.
I would just like to contextualize my perspective today. I was raised in the church. I'm a proud Christian. And Matthew 25:35 says, "For I was poor, for I was hungry, and you gave me food. I was thirsty, and you gave me something to drink." Brothers and sisters, whatever you did for the least of these, you did for me. And I believe that Christians have a mandate to feed the poor. And this is a mandate that's not just for the benefit of the hungry, but it is also a benefit to our own, it is a reflection of our own morality. It's a reflection of us submitting to God's will to say, eschew greed and take care of people. So reducing hunger is a mandate of Christian scripture. It's also been a goal of the federal government for decades. And, I'm not a legislator by training. I fix cars. So I had to do some research on SNAP. And I think it actually is a really elegant bill. The original 1964 SNAP bill has 3 parts to it: reducing hunger, supporting agricultural markets, and increasing the nutritional quality of the American diet. And SNAP is certainly one of the best tools we have for reducing poverty. But rural communities like mine are actually 23% more likely to be enrolled in SNAP than their urban counterparts. 45,000 families in my district in Southwest Washington rely on SNAP. And let me tell you something that is very deeply concerning to me. Right now, every dollar that Americans spend on food, only 14.5 cents make it back to the farm. 14.5 cents of every dollar spent on food makes it back to the farm. And I don't think it's a coincidence by any stretch of the imagination that we are seeing more rural dependence on SNAP benefits at the same time that we're seeing a lowering of the dollars that make it back to the farms, these rural agricultural producers. So my question is, how do we circle this economy? How do we use SNAP to feed back into supporting rural agriculture as we're supporting these families who are experiencing hunger? So, Mrs. Brown, my question is to you. How can we get these dollars, more of these dollars, back into our agricultural producers?
Thank you for the question. Certainly incentive programs such as the Market Bucks program or other farmers market programs, similar, I think are a really good option for that. I think any way that we can help incentivize both health and nutrition, but encourage folks to use SNAP and, whether it's in our state, it is state legislative dollars that help match that. That is a great benefit to our rural farmers markets. They speak about that all the time. I also just wanted to thank you for your work on cars. Transportation is a big issue in rural communities as well, and I just wanted to acknowledge that as well, that the comments about the distance to grocery stores is absolutely critically important.
Thank you so much. And could you elaborate on your testimony about the support SNAP provides to workers in rural areas of Minnesota?
Certainly. So, especially, it was mentioned a little bit earlier about retailers and the jobs that help with the grocers. But we've heard directly from grocers that say, without SNAP benefits coming into the community, the local grocery store would close. And so all of that spreads into the community. Every single dollar that SNAP utilizes frees up extra dollars. So if you are in a household and you, for instance, need to pay for your children's shoes, school supplies. If you have SNAP benefits, that frees up extra dollars, which then goes into your local economy.
Thank you so much. Thank you to all of our witnesses.
Thank you.
I yield back.
Thank the gentlelady for yielding back. And before I recognize Dr. Baird for 5 minutes of questioning, I just request unanimous consent to submit for the record a recent Department of Justice releases related to SNAP fraud. And this is actually it's from March 2nd, 2023. Without objection, the article will be submitted, and now recognize Dr. Baird for 5 minutes.
Thank you, Mr. Chairman and Ranking Member, and for all you witnesses to be here. Got a research background. I've been in production agriculture all my life. The interesting thing to me that I want to get your comments on here in a minute is our ability, the technology that's advancing agriculture, production agriculture. I mean, the kind of crops that we can raise today, and the quality and the ability to use CRISPR techniques and really define the genetics of what we produce. So my question is, and I'm going to start with Dr. Stover. You indicated that production agriculture could really contribute to human health. And I really want to emphasize that because I think we could do things in production agriculture that really would contribute to human health. And I'd just like your thoughts on that.
There's absolutely no question about that. And I just want to go back to a point that was made about the amount of food income that actually, or food purchasing that goes back, the dollars that go back to the farmer is really small. And again, that's because we have an agriculture system that is built around reducing hunger to make food in abundance so that it is as affordable as possible. We have the external, in that model, we have this externality, if you will, of really high healthcare costs. So that's where the money is in agriculture. It's in the healthcare sector because of diet quality. And so how do we reimagine a food supply that both addresses hunger and addresses health? And as you mentioned, we have so many tools today that we can make the food supply whatever we want it to be. We can use CRISPR, we can use genetics, genomics to change micronutrient composition. We can play with caloric density. There are so many things we can do, but we have to incentivize that in a way that production agriculture will adopt these, because the model they're in now, margins are very low because of that end point of keeping hunger as low as possible. And so this can be done. We need a different economic model, and we have to somehow bring together healthcare economics and ag economics to make this work, because otherwise we're going to continue to lose a lot of our precious farmland to more profitable purposes like solar panels.
I couldn't agree with you more. So I would like to continue on with the conversation with you, but do any of the other witnesses have any thoughts about in that area? I'm talking about the nutrition that we can create in production agriculture, and I'm not sure very many people are aware of that. But we can alter the kinds of grains, the kinds of, as he just mentioned. So I'd like for us to put some emphasis in that area because it's important to production agriculture, and as he mentioned, it's important to save the farmers and ranchers. So if anyone else has a comment, I'd appreciate it.
Yeah, I'll just comment a little bit, and maybe just from the data standpoint of what we found in eastern Kentucky. So as we've sent family food boxes there with chicken, potatoes, mini oranges, milk, butter, apples, and juice boxes. I guess the comment would be is food recipients, they absolutely desire and seek nutrition. Like they're not avoiding it, they're not trying to use their dollars elsewhere. If they have a choice, nutrition is absolutely high on their list. We surveyed them, and they said 81% were very satisfied and 84% with what they received in the boxes. And then we also asked them about health, and 84% responded saying it was very healthy. And so we've got confirmation that those that are in rural, remote areas that are receiving nutritious food boxes with produce and dairy and meat are extremely grateful and thankful to have that nutrition brought to their doorstep.
Yeah, Mike, I think your microphone's off.
Thanks, Mr. Chairman. I need all the help I can get in this day and age. Anyway, I don't know how much time I'm getting into, but Mr. Hodel, I'm impressed with the Midwest Food Bank. You're doing that without any government help and assistance. So my question really is, how are you able to do that? I mean, how does that work? Quickly, we got 22 seconds.
So our model, again, built around volunteers. And so we keep a very low staff, a very low period cost structure. We seek private donations. We work with corporations, small businesses, large business, churches. So we're very thankful for the donated dollars that help support our operation. It costs about $2 million to run one of our locations, and we distribute about $60 million of food back into that community.
Fantastic. I thank you very much, and I yield back, Mr. Chairman.
Gentleman yields. Now recognize the gentleman from North Carolina, Mr. Davis, for 5 minutes.
Well, thank you so much, Mr. Chair, and to the ranking member for having us together today. There's an issue that remains close to my heart, and that's veterans, our veterans. Those soldiers, sailors, Marines, airmen who've worn the uniform in service to our country. Our research shows that food insecurity particularly impacts veterans who have recently left military service with lower final salaries and those who had lived in rural or low-income areas with limited access to food. USDA recently found that working-age veterans face 7.4 times more significant risk of food insecurity than the general population, and about a third of all working-age disabled veterans are food insecure. Food insecurity is a critical issue in eastern North Carolina, rural America, and across the country. North Carolina's 1st Congressional District alone is a home of over 46,000 veterans. And in North Carolina, veterans are nearly twice as likely to have a disability than nearly twice as likely to have a disability than non-veterans, with 30% of the state's veterans reporting a disability in 2019. The Supplemental Nutrition Assistance Program serves as a safety net for many veterans. On average, about 1.2 million veteran households participate annually. Unfortunately, far too many eligible veterans do not participate in the program. A recent CDC survey found that nearly 60% of eligible veterans do not participate. The recent debt limit agreement had a critical new exemption from SNAP's time limit on benefits for veterans, which should help ensure more veterans can access SNAP's essential food assistance. I would like to be clear that my support for legislation that helps Americans, and those in particular, children, families, seniors, and yes, indeed, our veterans. So I would like to direct just a couple questions to Ms. Brown. How do you think the new time limit exemption will help veterans?
Thank you, Representative. I'm excited about this prioritization towards veterans. In our state right now, we actually do not know how many veterans are currently on the SNAP program. It's not a code that we have in our system. So with this prioritization, this will encourage additional partnerships with Veterans Affairs and other like-minded groups, and will allow us to track and prioritize this population. We do know that many veterans have high unemployment rates for their spouses. There's some stigma associated with applying for the SNAP program. So again, this partnership, and I think coordinated with SNAP Outreach, will really focus in on this population.
Okay. And then my follow-up question here, what other policies should Congress consider to reach and address the needs of America's heroes, our veterans?
Thank you. In addition to increasing SNAP outreach, I wonder about categorical eligibility, identifying veterans and making some type of policy impact so that they are eligible for the program depending on their status. I think that would reach the population that we're trying to reach and will encourage more participants to apply for the program. I will say in Minnesota, while we haven't tracked it on the SNAP side of things, it has been a big focused effort on the homeless side, and they in fact are eliminating veteran homelessness, so we have a lot of good lessons to learn there.
Okay. Thank you so much. And Mr. Chair, I would conclude today by saying to those who are present and have served, thank you for your service to our country. And as we continue to do our work here, let us continue to fight for those who fought for us. I yield back.
Thank you. Ms. Davis, would you yield just
Yes.
a little bit of everything? Follow up on the question he asked. What President Biden insisted we put into the debt ceiling regard to, and the three groups are there, homeless, veterans, and quite frankly, those children that are aging out of foster care. Is it helpful, the fact that under the provisions that the president insists to be in there, these folks are not going to be eligible for SNAP education and career and technical education benefits that other individuals up to age 54 would be?
So I think your question is they won't be eligible for SNAP education with this and
That's
career-
correct, because they're automatically going to be waived from those job opportunities.
Right.
So, and we'll talk offline.
Sure.
Time's expired, and I try to be a good example, so thank you. Please recognize for 5 minutes the gentleman from Iowa, Mr. Feenstra.
Thank you, Chairman Thompson and Ranking Member Scott, and thank you for our panel today. I greatly appreciate what you're doing. I've read your testimonies, and they're very impressive. With more than 80% of the expected cost of the Farm Bill going toward nutrition programs, Title IV is very important to us, and I'm glad we're holding this hearing just to discuss it. I heard Jerome Powell, the head of the Federal Reserve, talk probably about 6 weeks ago, and he said the reason we have pretty significant inflation right now is because of employment, meaning that we have 10 million jobs available and we only have 2 million people unemployed. And the cause for the inflation is that obviously the workforce is in demand, high demand. So you have businesses looking for workers and they have to pay more, which is causing inflation. So this is my concern. Ms. Rashidi, sorry, I didn't mean to mess up your name there. You outlined in 2019 30% of the able-bodied adults without dependents between the ages of 18 to 49 worked while receiving SNAP, meaning about 70% of the recipients did not work at the time. And I really don't want to go into that, but what I do want to go into is how can we use SNAP, right? How can we use and work together collaboratively to connect those unemployed workers with employers begging for workers and causing this inflation? Can you reflect on that or have any ideas on that?
Sure. So my experience working within SNAP in New York City, I certainly found that work requirements can be useful in the sense that they introduce the conversation about employment with SNAP participants. And I think that crucial touch point with individuals who obviously are experiencing temporary financial insecurity coming in, employment should be one of the main parts of the conversation in how to help that individual achieve, escape poverty and achieve upward mobility. So I think it is crucial to bring in employment, and then having that discussion about employment combined with a work requirement will ensure that those individuals are looking for work and can meet the needs of the broader labor market.
Yeah, I appreciate that. And I just think, and I'm trying to, this is a positive moment, I think, that we have this stress on our economy right now, and how do we work collaboratively to incentivize, and we want to bring people out of poverty. That's got to be our number one goal. How do we do that? How do we create that? And I think we have a wonderful opportunity to do that here. Mrs. Rashidi, I got another question. According to the National Skills Coalition, in 2018, 52% of jobs require education that falls between high school diploma and a 4-year degree, but only 43% of workers have the skills. So what we're saying here is that 43% of society do not have the skills or ability for the jobs that are required. Again, and you sort of noted this, is there a way that we can create training programs within SNAP to encourage apprenticeships or trade schools? Can we, again, I'm looking for partnerships here. I'm looking for anything to help bring people to the next level and get them jobs and get them out of poverty.
I think there definitely are opportunities to do that through SNAP education and training. Part of the problem, though, is there's a lot of SNAP education and training dollars that are spent on programs that are not effective. Yeah. And so if we could discontinue funding for programs that are not effective and move it to programs that are effective, like partnerships with community college, that actually ensure SNAP participants get a credential and can get a sustainable job, that would be a positive, in the positive direction, and discontinue programs that are really proven to be ineffective.
Yep. Thank you. Thank you for those comments. Ms. Royal, in your testimony, you mentioned that the Food Nutrition Service reports fraud rates within SNAP are less than 1%, which is wonderful, but your organization has estimated fraud rates range from 8 to 40% of households currently enrolled. That's quite an extreme change. I'm just wondering, could FNS be addressing these issues of fraud today, and why are they not currently prioritizing this? To me, this is sort of a moment that we need to look at and say, okay, we need to be effective with our dollars, and are we truly doing that?
I would love FNS to take more of a look at fraud. I think that would be fantastic. Asking why they don't, I mean, that's been the topic of discussions that I've had for a very long time. The SNAP budget spends 1/20th of 1% on fraud detection, prevention, and prosecution.
Yep.
Again, they hold to that 1% fraud rate, but even with the 1% fraud rate, 1/20th of 1% doesn't seem to even address that.
I think you answered my question for me. Absolutely. Thank you, Ms. Royal. And I yield back, Mr. Chair.
Thank you. All right, we'll go to Ms. Takuda for 5 minutes.
Thank you, Mr. Chair, Ranking Member. You know, upon coming to Congress, I wanted to join the Agriculture Committee because I saw a great opportunity and hope in the 2023 Farm Bill. It was a chance to support our agricultural producers, increase our food security, strengthen our economy, feed our people. So you can imagine my anger and disgust as I have watched the Farm Bill become weaponized by House Republicans, including Speaker McCarthy, as a way to literally take food out of the mouths of our older Americans. In fact, members of this committee have put out proposals that would cut SNAP benefits and put at risk many of the adults that we have in our communities. As many as 2 million older adults would be at risk of losing their SNAP benefits. I want to focus on something that is close to my heart as well, senior hunger. Older Americans are among our country's most food insecure populations. We should be making it easier, not harder, for them to access food assistance. Rates of food insecurity among older Americans remains higher than pre-Great Recession levels. A study by Feeding America found that in 2021, and you know it's only gotten worse, approximately 5.5 million seniors were food insecure, with 2.1 million seniors having very low food security. Let me put it in simpler terms. Our seniors, our grandparents, our elderly neighbors, our retirees, they go to sleep hungry. They wake up hungry. On a fixed income, they are forced to choose between food and medicine, a roof over their head. One of my constituents on the Big Island over in Hawaii, he was kicked off of SNAP because of a $7 increase in his Social Security benefit as a result of this year's COLA increase. $7. That can't even buy you a dozen eggs in Hawaii. That left this senior with zero SNAP support. Significantly cutting funding for SNAP will result in millions of low-income adults losing their food assistance, including seniors, children, families, people with disabilities. Penny wise, pound foolish. The consequences of these cuts are far more devastating than any proposed budgetary savings. I will not support legislation that takes food away from low-income households. In my home state of Hawaii, 30,000 older adults participate in SNAP each month. And this is just half of the total number of seniors in Hawaii who are eligible to participate in the program. Last month, while I was visiting many of our SNAP processing centers throughout our islands, I heard countless stories from family members and SNAP workers of seniors who are not on SNAP, but they could be and they should be. Too many seniors in Hawaii and across our country are not accessing SNAP benefits because they have difficulties navigating the application system. We heard a little bit about it today, or don't want to apply because they feel that they would be taking away limited funding away from other families in need. And while that's admirable, it's a false choice. Let's be clear, that is a false choice. Seniors should not be put in a position to either choose between feeding themselves or their communities. This issue isn't unique in my state. In 2020, it's estimated 5 million older Americans who qualified to receive SNAP were not enrolled in the program. This means close to 3 out of every 5 seniors eligible for SNAP is missing out on critical nutrition assistance that can provide them not only with food, but the greater means to lift themselves and their loved ones out of poverty. So again, let me put it in very simple terms. Millions of elderly Americans, our seniors, our grandparents, our retirees, our neighbors, they are going to bed hungry. They wake up hungry. Ms. Brown, why is SNAP participation among eligible older Americans so low, and how can we improve access to SNAP to ensure the program reaches those Americans in greatest need? How about demonstration projects like the Elderly Simplified Application Project that helps increase SNAP participation or ease the application process for older adults? And are we taking into consideration access issues in our rural and remote communities? We heard about it today. Language barriers, something that's an issue with my constituents, and broadband access and our seniors' ability to navigate even simple online or telephonic platforms. Would love your thoughts on that.
Sure. Thank you. Certainly, we support any simplified application process for seniors. We recognize and hear some of the same stories that you've heard from seniors that are reluctant to apply for SNAP because they're worried about taking away from somebody else. I will say that in Minnesota, when we lifted our asset test, so I think asset flexibilities are incredibly important. That was the #1 reason why seniors were not applying for SNAP. And when we lifted that asset test, we were able to see a SNAP increase from a rate of 25% to 58% for our senior population. So that's a significant option. I think also looking at medical deductions, expanding some of the medical deductions that could be utilized would also benefit our senior population.
Thank you very much. I know I'm out of time. Those are all things we really need to take into consideration. Senior hunger is real, my colleagues, and we've got to do more to make sure they can access SNAP. I yield back.
Thank you. I now recognize the gentlewoman from Texas, Ms. De La Cruz, for 5 minutes.
Thank you so much, Mr. Chairman. I think we can all agree that integrity and accountability are important when it comes to SNAP and other benefits, whether it's fraud, criminal activity, or state activity or state issues that cause this type of fraud or criminal activity. We all want to understand why and how we can do better. We want to make sure that it's mitigated. Ms. Royale, I'm going to address this question to you. Can you flesh out some of your ideas to help mitigate some of these issues?
Sure. Identity verification on the front end of an application would be very, very important. I discussed very briefly.
Can you please expand on that? Because we heard that they do have to show their social security card. What do you mean by identity verification specifically?
The ability to leverage technology to verify that when somebody presents themselves, that they're actually who they say they are, that their social security number belongs to them, that they are eligible to receive benefits, meeting all of the different criteria, that they're not receiving benefits in duplicate states at one time, to verify that members that they have listed in their household exist, to verify perhaps people who are not listed on the application do live in the household. So being able to leverage technology to help that verification process would be very significant. I mentioned increasing the retention amount. It seems to be a really simple way to do that. So in previous years, the retention amount from the dollars that states recovered from overpaid benefits was 50%. That has been reduced down to 30% in fraud claim, or 35% in fraud claims. But increasing that back up to 50% would provide the funding that would allow states to purchase and be able to access that type of technology. Tying that money, making sure that those retention dollars are mandated to be used for the prevention, detection, and prosecution of fraud. In many states, that retention money goes into the general fund and is used elsewhere. So the benefit, or the fraud units don't have the benefit of that money.
So let me ask you something. Right now, as it stands, does the system allow for you to check with multiple states to see if there are benefits, or is it just at the word of the beneficiary of these programs?
We don't have a way to check. So there are states that still utilize or still have access to the original NAC project. I believe there's 6. So the rest of the states, we have to rely on that self-declaration in an application that a recipient has received benefits in another state. And when they provide that information, then the issuing state can contact the previous state and make sure that, again, dual issuance isn't a problem. But it's also a problem when people intentionally omit the answer to that because they want to receive benefits in multiple states. And then our hands are tied. We don't have a mechanism to find that type of false statement.
So as I'm hearing, it is really just a self-declaration. That's the only way to find out if someone is receiving benefits in multiple states.
For the most part, yes, that's correct.
Typically, people who are intentionally trying to take advantage of the situation won't self-declare that, I imagine. Moving forward, these retention dollars, you said that it was reduced from 50% to 30%. When was that reduced?
35%.
Or 35%.
It's in the footnotes in our written testimony. I don't recall the specific year. But again, not only was it reduced, but there are no mandates of how the money is used.
So what I'm hearing is increasing it back up to the 50%, but also giving mandates as to where that money is used once it is recovered.
Right, and I think it's really important to say that 50% has to do with fraud claims. So the state does the fraud investigation. They prove that it's a fraud, that fraud has occurred, a false statement has occurred. They establish the claim, they collect that claim, and then the money that they collect, they split with USDA. So again, we're recommending that we have a 50-50 split and that there's a mandate that the $50 or the 50% that we recover be used for the prevention, detection, and prosecution of fraud.
Thank you very much. With that, I yield back.
Thank you. I now recognize the gentlewoman from Illinois, Ms. Budzinski, for 5 minutes.
Thank you, Mr. Chairman, and thank you, Ranking Member, and thank you to the panelists for being here today. Before I wanted to start with some questions, I thought it would be important for my colleagues and the panelists to hear a few stories from my constituents who rely on the support that SNAP provides. And really, I think you'll hear I'm amplifying what my colleague, Congresswoman Takuda, really eloquently stated around the importance for seniors and older Americans to SNAP benefits. And so I'm going to highlight a few of my constituents that are older Americans and their stories and that importance of the SNAP benefit. Kathy, a 66-year-old from Decatur, Illinois, lives on a fixed income of only $1,088 a month. She gets $98 a month from SNAP and pays around $100 on food each month. As someone living with diabetes, Kathy shared with me that a lot of the high-carb foods offered at local food banks send her blood sugar through the roof. She uses her SNAP benefits to buy fresh fruits and vegetables that help her to stay healthy, and that SNAP benefits, she said, are a matter of life and death for her. James, a 66-year-old from Urbana, Illinois, shared that the $55 a month that he receives in SNAP benefits barely help him get by. He told my office that if I didn't have SNAP, I would starve. And Don, a 56-year-old from East St. Louis, told us that he doesn't know what he would do without the $100 he receives each month through SNAP. It's the only way that he can put food on his table. These are the stories of my constituents, as I mentioned, who depend on SNAP, each of them over the age of 50 years old. Nationally, SNAP serves about 5.3 million households with elderly individuals each month. That's nearly 30% of all SNAP households. In my home state of Illinois, about 240,000 older adults receive food assistance each month from SNAP. Far too many of our nation's seniors struggle with food insecurity each month, and this crisis is even more dire for older adults living with disabilities. In 2021, older adults with disabilities had food insecurity rates more than 3 times as high as those without disabilities. Even among those who are food insecure, seniors with disabilities are more than 2 times as likely to be food insecure and are 3 times as likely to be very food insecure than seniors without disabilities. SNAP is a lifeline for seniors and older adults, helping to address food insecurity and improve the quality of life for its participants. SNAP participation has been linked to lower health care costs, including lower Medicaid and Medicare costs. A study of 60,000 low-income seniors recently found that SNAP participants are 23% less likely to enter a nursing home and 4% less likely to be hospitalized in a year after receiving SNAP than non-participants. And that is why I will not support any policies that result in food being taken away from Kathy, James, Don, and the many other older other adults in my district who depend on SNAP to put food on their tables for their families. And so in the remaining time that I have, I did want to ask Ms. Brown, you elaborated a little bit, my Congresswoman Takuda, my colleague, had asked you about specifically what we can be doing to break down barriers for seniors to access. And I know you mentioned simplifying the application process. I was actually also going to highlight the medical deduction, but are there any other ideas that you might offer to us to help us make sure that seniors, some of our most vulnerable population, get access to SNAP benefits?
I think the important thing in this conversation, and appreciate all of the stories because they're exactly, like I said, what we hear from participants every single day, is that participants have an extremely complex life. No, you can't. One participant, when you speak to one, right, it doesn't explain all of the SNAP participation, across the board. And so, as we think about all of the flexibilities that are important for families and for seniors and for disabled individuals, it's important to think about the barriers that they face and ensure that we have policies that allow for flexibilities to really serve those that need it.
Great. I'll yield back my time. Thank you.
Thank you. I now recognize the gentleman from California, Mr. Duarte, for 5 minutes.
Thank you, Mr. Chairman. I'd like to talk more broadly about abundance and access implications of our farm bill, our farm policy. We have a lot of biofuels, a lot of acres of farming, a lot of farming resource, a lot of food resources going into biofuels, a lot of restrictions on animal protein systems. We can see in Europe we're shutting down whole industries of dairy and swine. I'm from California. I represent a district that is, we looked at it, the 18th highest poverty level in America. It's a rural farm district. I'm a farmer by background. And so I'm very interested, particularly for you, Dr. Stover and Dr. Riccardi, what do you see as the broader implications of our farm policy in general? We had the EPA director, Mr. Reagan, in here a few weeks ago, mentioned biofuels 32 times. We counted them. And I just think the implications for that in terms of tying up our food production resources to produce biofuels, because of what I believe are sentimental reasons, is really going to come down hard on working families and their food access, especially when it comes to produce and protein that diversifies their diets. And I'm very concerned that this might be the first generation in America that is actually moving our diet away from additional produce and protein and diverse nutrition on the dinner plate towards a higher starch-based diet, which we all share concerns and health concerns with. I don't think we can bioengineer our way around that. So I'll start with you, Dr. Stover, and then I'd like to go to Angela Riccardi.
When we use food to promote health and prevent chronic disease, which is a major initiative that was started at NIH by former NIH Director Francis Collins, what we recognize is that in the diet-health relationship, one size does not fit all. So when hunger is the outcome, everyone responds the same. When you have a health outcome and you want to use food as the solution to healthcare costs, people respond differently to foods. This relates to our past history as humans, where human populations emerged all over the world. Those that have survived and thrived adapted to local food systems. This is why you see hemochromatosis in Scandinavia, et cetera, et cetera. We need a highly diversified food system to meet the nutrient needs of all individuals if we want to use food and agriculture to promote health. We have to understand that better, but in the meantime, we need a highly diversified food system, and we need to put health first.
Are we displacing our highly diversified food system with commodity crops, farm policy, and biofuels?
And I would agree with that statement. I think that that is driven by the incentives. We have to look at the incentives that we have, that farmers and ranchers are business people. They're going to make decisions based on the business. If we want to use agriculture for health, we have to get the incentives right.
Dr. Riccardi, thank you.
Yes, I would also agree with that. And I'll just say, I mean, you mentioned that you worry that we're moving towards this diet of highly starch. I mean, we're already there, right? Like we've seen that happen, and it's having devastating consequences on health for individuals, but it's also hurting farmers because it's changing production, it's changing how they farm, and it's also hurting the earth, to your point. So I think, I completely agree with Dr. Stover that we need just kind of a whole-scale look at our food system. And certainly incentives and disincentives that are put into the Farm Bill play a big role in that.
Thank you. I'm also concerned that our green energy, our movement towards biofuels, our movement away from carbon energy is limiting opportunity for the American working family. That lower income working families are having their opportunities greatly limited because we can't power the grid. We know that other economies that are growing faster than ours have emerging middle and upper classes that are competing with our working families for the produce and protein and dietary diversity that we produce. I mean, I'm in California. This is a global food system. In a global food system, the most desired foods will go to those who can pay the most for them. And do you share any concern that our disadvantaging our economic growth through certain green energy policies primarily is hurting our working families and indirectly hurting their diet options?
So my comment to that is we need to support agriculture in all of its forms for reasons of innovation and to meet the needs of local communities. And so in my mind, this is more of a local governance, local economy effect, where what type of an agriculture system do you need for a given nation, for a given state, that's going to best support the goals of that individual state.
Thank you. I think it's time for me to yield back.
Thank you. I now recognize the gentleman from Illinois, Mr. Sorensen, for 5 minutes.
Thank you, Chairman. Like many other members up here, SNAP has served as an essential safety net for my constituents and boosts income for the agriculture industry. That's why I do not support changes to SNAP that will take away food from older Americans, children, families, veterans, people with disabilities in the Farm Bill or otherwise. Cutting benefits would also harm our nation's farmers, who are supported by programs like SNAP and incentives within it. More than 21% of households in my district in Western Illinois participate in SNAP. These are neighbors of mine. They're children, they're veterans, senior citizens, they're disabled, folks who are struggling, or just folks who are down on their luck. It's our responsibility in Congress to help people, not take the help away. And unfortunately, many eligible Americans don't even. The Census Bureau has found that 1 in 6 eligible Americans did not participate in the program. And I believe that that's an area where SNAP needs innovation, it needs modernization. And so my question, I'll start with you, Ms. Brown. Based on your experience in Minnesota, what are some of the obstacles that people face when they sign up for SNAP, and how have these barriers affected your team's ability to be efficient with the program?
Thank you for the question. Certainly, technology has been a big conversation today, and I think technology we have not had a modern system across all of our nation, and we have not been able to keep up, right, with other technologies. And so certainly access is a barrier as folks try to apply for the program. Understanding that SNAP is available to them is also a problem, and we face stigma across the nation as well. And so depending how the conversation goes, right, folks may feel shame and feel that this isn't a program that they should be applying for, when in fact we do want folks to apply and to be on the program to stabilize and move their way to economic self-sufficiency.
Do you believe that the need is greater today than it was yesterday?
Absolutely. We are in a recovery period from the pandemic, and folks that have experienced poverty and have been through the pandemic need a longer on-ramp to reach self-sufficiency and stability.
Thank you for that. Mr. Hodel, thank you for your testimony and for your commitment to our home state of Illinois, and we share the same congressional district. Your testimony notes that your business model relies on donations for food, financial support, volunteer efforts. Are we meeting the needs of our kids, of our seniors, disabled, and veterans in need?
Yeah, I believe so. And the reason is we distribute our food without discrimination, and we're very inclusive and very broad with our agencies. So we're in the wholesale space. We're not providing food to the food recipient. That's why we work with our agencies. In Illinois, we have 550 agencies that are distributing food. I think that's key. As you talk about food access, those soup kitchens, those churches, those local pantries in every town, they know their community best. And so what we do at Modernizing Food Bank is we make it very easy for them to come and receive food from us at no cost, and then they go back and they serve their communities. And so I believe they know their community the best, and they're well positioned to serve and reach those outlining areas, as well as you mentioned the students as well as the seniors and veterans.
What do I say to the single mother in East Moline, Illinois, that works 25 to 30 hours of her day just to be able to afford the child care, and then she can't afford to go to the Jewel at the grocery store at the end of the day or at the end of the week to be able to feed her kids?
Yeah, so I mean, she has a lot on her plate. Like, I've done a poverty simulation, and she's getting kids to child care, she's trying to get to her job, she's trying to get to different health appointments, and a lot of times she's maybe using public transportation. I think your message to her would be reach out in your community. Look for support. The government has some programs that will help you, such as SNAP, but it's an and, it's not an or. So you have, to that single mother, you have SNAP, and you have food pantries, and you have local organizations that want to help support the community. I'd encourage you to reach out and look for support in her community.
I'll ask the same question that I asked to Ms. Brown. Do you feel that the need is greater today than it was before? Do you agree with her on that?
Yeah, what we're seeing is the food insecurity need is greater. You have reduced subsidies from the government, and you have inflation. And it's really inflationary driven. What dollars it takes now to fill a tank or to pay your rent, we are definitely seeing kind of an increase. At the same time, our goal is to serve them for a season. So we have definitely tried to increase our resources to be able to serve this increased kind of spike or in fluctuation. But our hope is that through policies and just through general economics that it'll cycle out.
I agree with you. The need is increasing today, which makes me question why anyone would want to make cuts. I yield back.
I now recognize the gentlewoman from Illinois, Ms. Miller, for 5 minutes.
Thank you. Ms. Royal, I know you have already talked about the National Accuracy Clearinghouse, but can you speak on some of the differences and how the clearinghouse was supposed to be implemented and what the USDA has done instead?
Thank you. The 2018 Farm Bill mandated the National Accuracy Clearinghouse to be utilized by all states by December 31st of 2021. In late 2021, as I said before, that rug was ripped out from under us. So there was a determination made that personal identifiable information was not being securely maintained in the current working NAC project. And so a new NAC was offered to be created using GSA 18F to create the new NAC. Several problems along with that. One being they didn't even talk to the states that were currently using the original NAC pilot to use their best practices, the lessons that they had learned while the pilot was being active. The other thing, too, is the new rollout is 2027. Oh. We've delayed it for a substantial amount of time. So now we don't have anything to use until 2027.
So since a clearinghouse has yet to be implemented, then how do states know if an individual or household is receiving multiple benefits in multiple states?
We don't know. We don't have a database to make that connection.
Do you believe this process is effective for preventing duplication of SNAP benefits from multiple states?
yes, there have been many reports indicating that it's been very successful.
Well, thank you. I hope we get this implemented ASAP, and I yield the remainder of my time to Congressman Desjardins.
I thank the gentlelady. I asked the chairman to enter into the record a document from USDA, Food and Nutrition Services, on SNAP policy for non-citizen eligibility. And what it will do is clarify some of the questioning from myself and Representative LaMalfa to Mrs. Rashidi and Ms. Royal. We'd asked about eligibility for non-citizens under 18 and asylees under Section 8 of 208 of the Immigration and Nationality Act. From USDA, it states non-citizens eligible with no waiting period, and I think you said there was a 5-year waiting period. There's several in this category, but the two we focused on were qualified alien children under 18 years old and asylees under Section 208 of the Immigration and Nationality Act. So I would ask with unanimous consent to introduce this into the record.
So moved.
And so I'm not doing this to be argumentative, but we're really trying to understand with the large number of immigrants that are coming into this country as we prepare to write the Farm Bill that already has 42 million participants, we could literally be looking at several million new SNAP recipients, and we need to be prepared for that. So that's why we bring up this question and just looking for clarification. And would either of you like to comment?
No, just I think what my statement was that 5-year time limit did not apply to them.
Oh, I'm sorry. I thought you said that there was
No,
a
sorry,
5-year waiting period.
Sorry if that was misunderstood.
I did misunderstand. Anyone else? Okay, I yield back the remainder of my time.
All right, I now recognize the gentleman from New Mexico, Mr. Vasquez, for 5 minutes.
Thank you, Mr. Chairman. And I appreciate our witnesses being here to discuss the nutrition title and the critical importance of SNAP. In today's hearing, I have heard SNAP being talked about from different perspectives. We've heard the words fraud, criminal activity, waste, identity theft, prosecution. We've also heard compassion, our American duty, health and opportunity, strengthening the middle class, and our Christian duty, and our Christian values. I think that says a lot about the value and the different approaches that we as legislators take to this very important program that in many cases is the way to improve the lives of Americans. Now, SNAP is not just a program that protects families from hunger. In my district, I know that it's one of the most important stepping stones to help lift families out of poverty. This program helps people get ahead by helping to cover critical food costs so that they can focus on the things that many of my colleagues have talked about today, like vocational training, finding a job, education, and eventually reaching the middle class. I know one thing for sure. Hungry people can't work. Hungry kids can't learn. Hungry families can't raise their children. And a hungry nation cannot prosper. In New Mexico, I served on the board for Casa de Peregrinos, an emergency food bank in the city of Las Cruces, and I saw firsthand the many reasons why kids and families need food assistance: losing a job, getting sick, divorce and family separation, situations that many Americans are going through today. And I specifically chose to serve on the Agriculture Committee to defend SNAP because it is that vital lifeline for my constituents. Now, last week, myself and many others who voted for the debt limit bill made it clear that we wouldn't accept changes to this critical program. And we were proud to have this be a bipartisan vote to expand SNAP benefits to veterans and to the unhoused. But some of my colleagues are also aiming to cut the program and making a conscious decision that would directly hurt the poor and working families, and I don't think we should let that happen. Mr. Hodel, as the CEO of a large food bank, what kind of anti-poverty impact have you seen emergency food assistance have on individuals who are served by both yourself and the clients that you serve?
Yeah, thank you very much for the question. The anti-poverty impact, I guess I would just go back to what we hear from our agencies, when we visit our agencies, when we're there for a loadout with their food recipients. We hear stories and we hear testimonies of individuals that went through a hard patch in life, and they were blessed by receiving food from their local soup kitchen or their food pantry. And they're super kind to be able to translate that back and also thank Midwest Food Bank for providing that food during that season. And so we get examples of individuals that have, or in New York City, and they receive food after a difficult breakup, and they're raising 2 children. And it's that food that has kind of got them through a season to then get their education and get jobs. And so sometimes we take our groups out and we're able to bring those food recipients from the past to share their story to the people that we're trying to encourage to support the work that Midwest Food Bank is doing. So I would say it's through kind of testimony and feedback that we get through our agencies.
Thank you, Mr. Hodel. I appreciate that. And I have heard many of those stories personally, serving an emergency food bank in the past, and now how important these oftentimes short-term solutions for families that are down on their luck, how important having that food in their household is for their kids and also for their mental well-being. In New Mexico, 12% of households are already food insecure, more than the national average. And Casa de Peregrinos, the CEO who I just talked to recently, told me that they're continuing to see an influx of new clients at the rural pantries that have all echoed the problems my rural constituents are facing: the cost of inflation, the cost of gas, the cost of groceries that are much too high. And disproportionately impact people in underserved areas, in underserved rural areas, harder than cities. Now, one of the reasons that I think we are seeing an increase in recipients of SNAP and other benefits is because of the growing wealth inequality in this country. The less money that people have in their pockets, although they may be employed, although they may be working those minimum wage jobs that we want Americans to take, it still doesn't stretch far enough to pay utilities, to pay insurance, God forbid somebody gets sick. And so I think some of the solutions behind why folks need food assistance and need to enroll in a program like SNAP has to do with the power of reducing wealth inequality in this country, which is a discussion we can and will continue to have, I'm sure, in other committees and in Congress.
Gentleman's time has expired. The
back.
chair now recognizes the gentleman from Texas, Mr. Jackson.
Thank you, Mr. Chairman. Thank you to the witnesses for coming today. I appreciate you being here. These nutrition programs are meant to be a hand up for the neediest Americans, yet time and time again we see cases of criminal organizations skimming and trafficking SNAP benefits from the true individuals that these programs are intended to help. Just last week, 3 people in Michigan were arrested for stealing more than $4 million from people more than 2,000 miles away in California. Mr. Chairman, could I please submit for the record the article from the Washington Examiner entitled "Michigan Catches $4 Million of Food Stamp Fraud, Mum on the Fraud Scope"?
Without objection.
Thank you. Ms. Royal, in your testimony, you mentioned how SNAP benefits are a target for identity thieves due to siloing and restriction on recipient data sharing. Could you please share with us how we could address these data sharing deficiencies to help combat these criminal organizations?
Sure. We just need a readjustment of the regulation, or a reevaluation of the regulation. SNAP is one of the few federal programs left that has the limitations and restrictions in it to share information. So a reevaluation of that, reconsidering the opportunities that states would have to provide that critical information to law enforcement and other agencies.
Thank you. Recently, USDA released a request for applications for their Supplemental Nutrition Assistance Program Fraud Frame Implementation Grant Program. This program is expected to award 9 different applicants with up to $750,000 to proactively detect fraud beginning at the application process and continuing throughout the recipient's time in SNAP. Projects eligible for this grant include efforts to detect potential fraud at the time of application. Ms. Royal, in your testimony, you mentioned that no date of birth, no Social Security number, identification, or driver's license is needed to access the system. Without these identification requirements, I'm not sure how any of these grant award winners will be able to detect potential fraud at the time of application. Mr. Royal, could you please explain how requiring a Social Security number on SNAP applications would help to limit fraud and abuse while not imposing an additional condition of eligibility?
We use the Social Security number in many different mandated ways. If somebody is disqualified in the program, states are required to enter that information into a national database. And we do that with name, date of birth, and Social Security number. And that's important when somebody's disqualified, depending on whether it's the first, second, or third offense or specific types of trafficking, depends on what the penalty is. And so, for instance, if somebody is disqualified in Missouri and they come later, commit an intentional program violation in Wyoming, it would be important for me to have that information to make sure that I request the specific or the accurate penalty. So we use it for EDRS. We use it for deathmatch certification. We use, again, the Social Security number is such a critical element to the different types, asset verification. I mean, there's certainly a long list, as was provided in our written testimony.
Thank you, ma'am. That helps a lot. Dr. Stover, change the subject just a little bit. In your testimony, you state that the new Texas A&M Institute for Advancing Health Through Agriculture is the world's first research institute to bring together precision nutrition and responsive agriculture research. I know you mentioned this also in your opening statement a little bit. This links food production to human consumption, thereby improving public health and lowering healthcare costs. This is just the latest example of some of the impressive work being done at Texas A&M and at the Texas A&M University system. Dr. Stover, I know you mentioned this briefly, but could you please expand on how the work you are doing at IHA could be used to develop a more realistic and usable dietary guideline?
Certainly. We have established in Fort Worth the world's first agriculture, food, and nutrition evidence center. In the medical field, there's no controversy whether aspirin is good for you or bad for you. There are accepted methodologies to look at the totality of the data, to combine that data, and then to say what the answer is, whether it's, whether there's a question about a policy, a practice, a guideline, and to say how strong the data is, how confident you can be in the science to make a decision that you know will be effective. Policy, a program, what have you. We do not have that in food, agriculture, and nutrition. So we have partnered with international consortia, the World Health Organization, FAO, to begin to set standards of evidence and methodological rigor into how we combine data, how we analyze data, how we present that data to decision makers like yourself, so that you have the ability to consider what the scientific evidence is and how strong it is, so you can be more certain in the decisions you make.
Thank you, sir. I appreciate it. My time's up. I yield back. Thank you.
Thank you. And we go from Jackson of Texas to Jackson of Illinois.
Hey. Thank you, Mr. Chairman. Thank you, Ranking Member Scott. It was 59 years ago that Reverend Martin Luther King said that he had the audacity to believe that people everywhere can have 3 meals a day for their bodies, education and culture for their minds, and dignity, equality, and freedom for their spirits. Such a belief shouldn't be an audacious thought. Ensuring no American goes hungry should not be controversial. That's why I will not support any bill that further tries to reduce food assistance and benefits to low-income households. Cuts to SNAPs harms our nation's most vulnerable, including children, families, older Americans, and those with disabilities. Just 59 years ago, those powerful quotes were shared. And here we are 59 years later, looking at 42 million Americans, including 15 million children, 5 million seniors, and 1.2 million of veterans that are needing this supplemental nutrition and assistance program. I am deeply concerned that instead of addressing our nation's persistent food insecurity, some people would like to suggest we should police the purchase of SNAP recipients. And it was in that same season in 1968 when Reverend Martin Luther King had the same thought, and his last moral mission was to declare a war on poverty. And now it seems as if we are engaging in a war on the poor. Restriction schemes that stigmatize program participants who are equally as capable of picking what foods they want to eat as each and every one of us, and would result in massive administrative burdens for USDA and retailers, ultimately increasing programs' costs and making SNAPs incredibly difficult to operate. When we start policing these food programs unnecessarily, it will run up the administrative costs. Right now, SNAP is an incredible example of a partnership that operates within the free markets, allowing recipients to purchase the foods that they determine will serve their families best. I would like to direct my comment, or if you will, my question, to Ms. Brown. Ms. Brown, in light of if there were increased restrictions placed on the policing of this food, how will that affect the retailers and families?
Thank you for the question. Retailers would need to completely overhaul their system. They are not equipped right now to separate out different types of food to meet any type of restrictions. So it would be a massive load for our retailers to manage. I also want to point out, as we think about restrictions on food for SNAP participants, USDA has a program, SNAP Education, that provides education, focuses on families with a limited budget, and focuses on physical activity. This program exactly meets the needs of folks worried about the health choices that SNAP recipients are making.
Let me ask you, if there were more benefits, if we raised the eligibility and increased the benefits, lowered the eligibility and raised the benefits, how would that improve health in our nation?
So again, supplemental. The program is Supplemental Nutrition Assistance Program, so $110 in benefits are received per person per month. That is not enough to meet anybody's food needs. And so by raising the SNAP benefit, it will decrease health costs. All of our studies in our state, as we've looked at the costs on health and the ongoing impacts of poverty on all of our systems, indicate that more benefits will decrease health costs.
My last question, these numbers move around. People are saying food insecurity. I take it that means hunger.
That's true.
Okay, hunger, I prefer to use that term. And then you're talking about $110 a month in benefits. We've heard of $2 per meal per participant, $6 a day. Can you explain the discrepancy?
So it would depend per state. So the $110 per month is specific for my state, and so it really depends on the variety of folks that you have that are participating in the program. So you may see some variance in the dollar amounts, but bottom line is it's not enough to in any way. The per month or the per day isn't enough to feed people.
So it can go from $3 per day in your state to as high as $6 a day for a participant in another state, correct?
It could, correct.
Thank you very much. Thank each of the panelists for your participation and willingness to come forward. I yield back my time, Chairman.
Thank you, Mr. Jackson. The chair now recognizes himself for 5 minutes. The relationship between the Farm Bill titles is symbiotic and all works together to accomplish these goals that I think my fellow committee members and I can all agree on. Number one, to make sure our farmers and ranchers have reliable access to risk management programs to ensure that they can feed, fuel, and clothe the world. Number two, to make sure our nation is fed. And number three, to make sure we are good stewards with God's creation. These goals are all dependent on each other. Without our hardworking farmers and ranchers, we can't feed our nation, and SNAP recipients are part of the market. If we can't feed our nation, we cannot be productive citizens. We don't have the healthy workforce we need, and our economy and society will suffer. And if we're not good stewards with God's creation through conservation and good farming and ranching policies, we will not be able to efficiently grow the food needed to feed our nation and the world. 12% of this year's Farm Bill will go to agricultural production programs. 5% will go to conservation programs. 81% this year will go to SNAP. Since 2015, this committee has had 39 hearings on supplemental nutritional programs. We care. We all care in this room. This should not be a Republican issue. This should not be a Democrat issue. This is an American issue. And using harmful and misleading and inflammatory rhetoric is neither productive nor helpful in us all doing the right thing. There is no reason that an able-bodied American with no dependents should not be either looking for a job, working, volunteering, or being part of a job training or search program. There's no reason that farmers and ranchers should not have the risk management programs they need to succeed. But there is also no reason that a nation as great as ours should let citizens who are truly struggling to find their next meal and feed their family go hungry. I believe firmly that we must return nutrition to SNAP. We must make sure we limit the fraud and abuse in the system. We must ensure that we are not enabling able-bodied citizens and making them dependent on the government, but instead bolstering them for success and self-worth. SNAP should be a life vest, not a lifestyle. But most importantly, we must all tell the truth and cut the harmful rhetoric designed to stoke fear, anger, and divisiveness in America. With that, I want to get to our questions. This one's for the panel. How long is the average recipient on SNAP? Does anyone know? Yes, ma'am.
In our state, depending on the population, we see it range from 24 months to 72 months on average.
How do we make sure that this does not become a lifestyle, Doctor? How do we make sure that SNAP does not become a lifestyle and it is a life vest for Americans?
Is that question to me?
Yes.
Well, I think having a employment component in SNAP, making employment a big part of SNAP, that it is intended to be a temporary program and employment really is the path out of poverty. I think sending that message is a crucial one.
In your testimony, you talk about the positive outcomes consistent and sustained employment has on families. What does that do for the psyche, having a job, even volunteering? What does that do for a recipient to help move them in the direction forward?
Well, there's a very large literature on the non-financial benefits of work. It improves mental health, improves physical health, it builds social capital, it builds connection to the community, it has positive effects on children. So yes, there's a very large literature that employment not only helps the financial security of a household, but it helps all sorts of other things as well.
Mr. Hodel, we're spending more taxpayer dollars on nutrition support than ever before, yet the rate of food insecurity still hovers about 10%. Where is innovation lacking, and where do opportunities lie for new ways to invest in these programs?
Yeah, great question. Thank you. I think, again, across the supply chain, in the food bank business, we're in the supply chain business. And so I think innovation all the way from working with retailers, food manufacturers, distributors, transportation, warehousing. And so, again, that's where we've tried to be creative in getting multiple sources and then multiple channels to get the food moved to our different food banks. And then also on the...
Thank you, sir. To be fair, my time has expired. I appreciate everyone on the panel. Next, let's go to Congresswoman Pingree.
Sorry. Equipment. Thank you very much, Mr. Chair. And thank you to the panel. Appreciate all the time you've put in today, and I feel very privileged to have had a chance to listen to so much of the testimony. I just want to emphasize the thing that always strikes me, having worked on this issue for many years. We are in the wealthiest country in the nation. We spend hours arguing whether or not people deserve food. That's why we're here again today. This was the argument that held up the debt limit. We're now talking about doing even more in the Farm Bill, and I am fully opposed to doing any more in this Farm Bill that would restrict people's access to healthy foods. I represent a very small rural state, one of the most rural states in the nation of only 1.3 million people, yet 23,000 households are on SNAP in my district every month. Statewide, we have 145,000 members, including more than 46,000 children who need access from SNAP. It's critical given the fact that Maine is the highest rate of childhood food insecurity in New England. We are talking about ways to cut SNAP, but it is becoming even more of a lifeline as families feel the impact of inflation and higher food costs, which disproportionately affect those people with lower incomes. The share of American adults who reported being in a worse financial position in 2022 than during the previous year rose to 35%, with inflation being the financial burden cited by most respondents, according to the Federal Reserve. Now, again, we're talking about constraining this program. We're talking about trying to require more people to be working and acting as if it is the constraint of the program. The fact is, there are not enough child care slots for people. There isn't adequate housing. There isn't always adequate transportation in rural areas. Those are all constraints on working, and we treat it as if it's somehow the product of SNAP. I hear my constituents talk about these concerns every day: food, gas, housing, and how that contributes to their inability to buy food. And we also talk as if we've forgotten that this situation that was, I grant you, getting better, It's been getting worse since we had the pandemic, supply chain shortages, the war with Russia and Ukraine, all things that have driven up food prices and made it that much more difficult to provide a healthy meal for $2 a meal, $6 a day, as we've been talking about. And I appreciate the testimony. Dr. Rashidi, you talked a lot about the constraints of SNAP for people's ability to get a job, but I disagree. I believe it's outside factors that makes it very difficult. It's also not people's bad choices necessarily on what they put in front of their food. I agree people need more healthy food, but it's very hard to provide food on $6 a day per person. A gallon of milk is nearly $5. We want to see people eating more fresh fruits, fresh vegetables, healthy proteins, which is why we should be talking more today about the GusNIP program, about produce prescriptions, about all the things that we could do to get more healthy food on the table. The other thing that I find really distressing about today is we're talking about making more cuts, more restrictions. Well, when 170,000 Mainers lost SNAP emergency allotments in March, $17 million a month was drained from our state's economy and taken away from hungry families. We've already made severe cuts. People are already reeling for what we have done, and now we want to talk about doing more. We also are going to talk about the impact that it has on our rural economies. During economic downturns, every $1 in new SNAP benefits generates $1.50 in economic activity. And we've heard people talking about how difficult it is in a rural community to get access to healthy food and how important that return is to our community. I recently met with Good Shepherd, one of our state's largest food banks, They're sending me photos of empty pantry shelves. USDA trucks carrying 900 cases of milk to Good Shepherd pantry partners used to take 48 hours to distribute. That's what they told me. Now the demand is so high that offloading cases takes under 3 hours. Preble Street Food Security Hub in South Portland is seeing a 100% increase in demand from March 2023 back to 2022. They are providing 800 boxes a month compared to 400 in March of 2022 and previous months. Clearly, I'm going to use up all of my time ranting about this, but the fact is, we're here today to talk about making more cuts, to making it more restrictive, to making it more difficult, and I can't say it enough. This is the wealthiest country in the world. We have plenty of policy to worry about. We have plenty to debate, but it should not be whether or not people can put food on the table. I yield back.
Thank you. The gentlelady's time has expired. We now go to Mr. Nunn of Iowa.
Thank you, Chair Alford, and the gentleman from Missouri. Privileged to be here with so many Midwesterners. And Mr. Hodel, I'd like to begin with you because you've really been feeding and caring for so many in the heartland, which we are incredibly grateful in my home state of Iowa to see what you do that are in desperate need of just the leadership that you are providing in this space. One of the things I want to highlight here is that I think we all agree. We very much want to be able to care for folks. This is one of the reasons the Farm Bill is so important. I want to focus in here on the Emergency Food Assistance Program, TFAP. In FY 2022, $1.17 billion were allocated to this, and a majority of it goes to Feeding America, a government-backed organization. Do some really great work. But for your organization, you operate with a very small budget and distributed more than $400 million in food without any of this help. I'd like to hear some of the really incredible efficiencies you have led and some of the innovation you talked about, and maybe we on the federal side here need to replicate what the food bank's doing.
Well, thank you for the question and the compliment. It's an honor to serve Iowa as well as our other states. Again, I go back to, our founder started this 20 years ago with really the mission of we need to serve our communities. And there's been some Bible references today, which I appreciate, but the Bible does call us and reminds us that the poor will always be with us.
That's right.
And so one of the things as I stepped into this job 6 years ago that I had to kind of think about and learn is like, we're not going to probably eliminate this, but we need to figure out how do we best solve. And again, it's for a season. The poor will always be with us, and I don't think there'll ever be not a need for food banks or not a need for programs. The innovation side of it, again, I point back to our model. We've really focused on a business model of high efficiency. Period cost walks in on 2 feet every day. And so we're very cognizant about the leadership and the staff that we have at each location. Each one of our food banks I talked about runs about a $2 million operational budget. There's 5 staff members. And I love going and walking somebody through our warehouses, and I'll give a tour of what we're doing. And we'll run into 50, 60, 70 people, and I remind that group that we're with that 5 of these people that you just saw are staff members, the rest are volunteers. So part of that model is core volunteers. We're blessed with people that retire at 50, 55, 60, and they're still a capable mind. And some choose to go to the gym to work out, others choose to come to Midwest Food Bank and to give us their time and to lift boxes. And so that core volunteer is a key model for us. And I think that helps our efficiency, kind of helps our leverage. And what we've been able to do is build a model that works and then scale it as we've gone to different locations. So we very much know that Illinois is Illinois, and Texas is Texas, and Arizona is Arizona. People ask us why we're called Midwest Food Bank. It is because our founder, again, 20 years ago, was trying to think big and didn't call it McLean County or didn't call it the Central Illinois Food Bank. He says, we'll call it Midwest because we surely won't outgrow that. And so God had different plans for the organization, but I think our core volunteers, our volunteer model, as well as just, again, the culture of we'll say yes and then we'll figure it out.
Mr. Hodel, well, compliments, and I think please continue to share those best practices with us, not only across the country for the volunteers who do it, but for the federal agencies that could really use you, I think, as a template on how to do this right. Very quickly, Dr. Rashid, I want to talk about our nation experiencing alarming increase in diet-related diseases among children. I've got 6 kiddos. 2 of them are foster kids. They went through a long process of really needing that hand up that was just talked about, but also the ability to survive on this in a healthy way. How can we in Congress remain focused on enhancing the nutritional and educational aspects of eating healthier habits in the upcoming Farm Bill?
I think that's a good question, and you're correct that the diet-related disease among children, diabetes, obesity, is actually a larger problem than hunger. Less than 1% of children have very low food insecurity, 20% have obesity. So I think that should be the priority in the Farm Bill, is how do we get healthier food into the mouths of children. The federal government does that through the National School Lunch Program, places very restrictive restrictions on what can be served in schools. I think they should take, maybe not quite to that extreme, but a similar approach with SNAP in ensuring that the program actually supports nutrition and does not allow unhealthy products to be purchased through the program.
Dr. Rashidi, thank you so much. Thanks to the panel today, and I yield my time.
Thank you. The chair now recognizes Mr. Kazar of Texas.
Thank you. Today we're discussing SNAP, otherwise known as food stamps. I had some remarks planned, but now I feel like I have to change what I was going to say because I just have to disagree with the gentleman chairing the meeting who said he wanted SNAP to be a life vest, not a lifestyle, implying that people could be living large on their food stamp benefits. To be clear, SNAP provides people $2 a meal, overwhelmingly to kids, working people, and seniors. You aren't living some kind of extravagant lifestyle on the few bucks you get to buy groceries. If my Republican colleagues want to talk about wasteful government welfare that lets people live large, then we should be talking about tax breaks for yachts. We should be talking about the multi-trillion-dollar Trump tax scam that overwhelmingly benefits the richest 0.1% of 1% and the biggest corporations. We've been told that folks on my side of the aisle have been using potentially inflammatory rhetoric, but this is personal. We're talking about families that are working really hard and just need a few extra bucks to eat. We're talking about families in my district in San Antonio that are working part-time. They're also taking care of aging parents and their kids. Maybe they can't get to that 20 hours a week worth of work, and they could lose the little benefit that they get, that they pay for in their taxes. Speaking of things being inflammatory, I still think it is inexcusable that the entire nation's debt ceiling, a threat of default, part of those negotiations that we never should have been having over whether America should default or not, were about some 53 and 54-year-olds having a harder time getting those $2 a meal. I personally believe that that is what is inflammatory. But we don't have to be in that divisive place. Instead, we should listen to our food banks and to our social service providers that help every single day, who are asking us to make it easier for folks to get this benefit, be able to get a meal, and be able to get to work and provide for themselves and for their families. In my own district, I'm hearing from small farmers who are struggling in drought conditions to get by, but these federal food assistance programs help them make sure they get their food to market, make sure they get their food to folks who need it the most, and help keep them afloat. I hear even from big retailers like H-E-B, one of this country's biggest private companies, asking and pushing to protect these basic nutrition benefits that we know help farmers, help retailers, and help those families. And so, Ms. Brown, if you could talk just a little bit about what it is that we can do to reduce the governmental paperwork that folks have to get through when they truly do qualify for the program, how we can find savings on our end, but ultimately benefit those folks that the SNAP program intended to benefit in the first place.
Thank you for the question. I'm a big fan of simplification, right? We have a lot of bureaucracy that we deal with, policies and procedures, and so any ways that we can simplify some of the requirements, make it easier for participants, make it easier for states to administer the program, and I think overall is a win. I'll give you an example of a time-limited SNAP recipient who didn't have access to reliable transportation, lived in a rural community, and wasn't able to get to the employment and training provider, and there wasn't enough jobs in his community. And so he was unable to meet the work requirement because of circumstances outside of his control, and will only receive 3 months of benefit. I don't think that's the intent of the program. We need to be able to feed people and meet their nutritional requirements while taking into consideration some of the barriers that they face. And so one example that would be really beneficial is to exempt training income. We have a lot of folks that want to provide training and build up people, and if they give them income as an incentive, that counts against them and it reduces their SNAP benefit or eliminates it altogether. So there are a number of ways we can simplify the program and make it easier for it all to work.
Thank you so much. As we begin moving forward on the Farm Bill, I look forward to supporting a bill that feeds more families, that supports more of our farmers, and I won't support legislation that takes food away from those low-income households. Thank you. I yield back.
Thank you, sir. The chair now recognizes the Cheese King from Wisconsin, Mr. Derek Van Orden.
Thank you very much, Mr. Chairman. I was raised in abject rural poverty by a single mother, and we were on food stamps. To answer the question that you're thinking about right now, they were not written on papyrus. I'm not quite that old. I had subsidized lunches, I had government cheese, I was being shot at literally as a Navy SEAL in combat, and my wife and I used WIC to help feed our children. So Mr. Molinaro from New York shares a similar story. So I will not sit here and be lectured by people who have not walked the walk that I have. I will not. I volunteered to be on the SNAP committee because I think these programs are incredibly important. And to say that Republicans are trying to snatch bread out of people's mouths is inflammatory, it is disingenuous, and it is not helpful. And I'm going to call a truce after I do this. It took less than a second for me to find a job in Sparta, Wisconsin, an entry-level position that paid $14.07 an hour. The $7.25 is ridiculous. So I'm going to ask my colleagues to stop it, and I will also, okay? Enough. Let's work for the American people and not try to legislate by sound bites. Inappropriate. Ma'am, Mr. Rashidi, I'm not sure that I agree with you dictating what people should be eating. I just don't. I think it's inappropriate. We're trying to get whole food or whole milk back into schools, and the reason it's not there is because it was removed by a previous administration. So I'm not a fan of the government dictating to people what they can and cannot eat. They say that we already provide microwavable foods to folks. Well, guess what? When I was growing up, we were too poor to have a microwave. I can take you to places in Baltimore right now, or within a mile and a half of this room, and they don't have a microwave because they can't afford it. Or they're latchkey kids and they don't know how to prepare food. So I don't want to mandate what people can and cannot eat. I think that's inappropriate. I do agree with the rest of the stuff you're saying, but just so you know.
Ms. Brown, are you aware that last September it was revealed that a Feeding Our Future, a Minnesota-based nonprofit, allegedly exploited USDA child nutrition programs to defraud the American taxpayers of over $250 million intended to feed hungry children during COVID-19?
I am aware that was with the Department of Education, not
Yeah.
the Department of Human Services.
I understand. Similar programs. So can you admit that fraud does exist in these programs?
Oh, absolutely.
Okay.
I think there are bad actors.
Right on, everywhere, right. So we can't legislate by exception, correct?
Say that again?
So we can't legislate by exception.
Oh, absolutely.
All right. And G.T. Thompson says that he really wants these programs to be a hand up, not a hand out. Do you agree with that?
A hand up, not a handout.
Yeah.
I believe that the SNAP benefit is incredibly beneficial to people.
Yeah, I'm 100% with you. So with that in mind, how many people have been raised out of poverty that have used your programs?
I know that I don't have any of the stats in front of me, but we can certainly send that to you afterward. I know that there are numerous studies that indicate childhood poverty has been reduced by the receipt of SNAP.
Okay. Well, I would like to see those numbers because I'm a member of Congress now because of these programs. I take this very, very seriously. Mr. Hodel, I would posit the reason that your programs are so incredibly successful is specifically because you do not receive any government funding. Do you concur?
That's been our business model, and it's been part of our success.
Okay, so out of all the things we've talked about, all these incredibly important programs, we've got one example here where your ROI just blows it out of the water. So you're involving the community in a godly fashion to help our fellow citizens, our neighbors, in a way that is incredibly productive, and it has zero involvement with the federal government.
Yes,
correct?
sir. And I'll just, we do have some involvement with the government when you say zero. For example, we see farmers to food boxes. So I just
Okay.
want to acknowledge that that was a government program that
Right
was a
on.
benefit to us.
But so you have a minimal involvement with the federal government?
Very, very, very minimal.
Okay. Well, I'm very proud of you. And I do appreciate the Christian sentiment by my brothers and sisters here on the committee. I too am a Christian. And you're right, the poor will always be with us, but that doesn't mean we don't try helping them on a daily basis. So thank you very much for your work, everybody. With that, I yield back.
Thank you, sir.
Thank you. I now recognize the gentleman out of California, Mr. Carbajal, for 5 minutes of questions.
Thank you, Mr. Chair. Last week's debt ceiling vote saved our country from a catastrophic default. As a result of that negotiated deal, additional work requirements were placed on SNAP. I want to make it clear, I am not inclined to support any farm bill that will take food away from low-income households. I will not support a farm bill that does that. Cuts to SNAP harm our nation's most vulnerable, including children, families, older Americans, and people with disabilities. As someone whose family depended on SNAP when I was young, it is disconcerting to hear the over-obsession by some who have about the specifics about what low-income Americans buy and eat. Wanting to monitor the specific nutrition intake of choice families who are food insecure is demeaning, demoralizing, and unfounded. Studies have shown that SNAP recipients purchase essentially the same foods at the same rates as other Americans. It's always those with the least who we are most obsessed with taking their autonomy away and wanting the most government intrusion into their lives. Nutrition and healthy eating are challenges that we are all struggling with, regardless of class and income. We should all eat more nutritiously. But those with the least are also the least able to afford fresh produce and other times intensive healthy foods that take a lot of energy and know-how to cook. I, for one, am a terrible cook. Again, we all share the goal to promote good nutrition and nutrition education. While we already do that, there's definitely room to do even more. So let's focus on ensuring we are accomplishing that goal and work together to support expanding and improving GusNIP, which helps low-income families afford nutritious food, and SNAP education, which teaches families about nutrition and how to cook nutritious foods they might be intimidated by because they've never bought them before. Ms. Brown, as someone involved in the administration of SNAP, Can you speak to the incredible burden restricting SNAP purchases would have on states and recipients?
Thank you for the question. Absolutely. Restricting any benefit and any of the food choices that folks are able to make would be incredibly burdensome, not only for retailers, but also for recipients themselves. We've worked really hard over the years to reduce stigma in the program. The EBT card actually helps with that. We don't have the paper coupon, the stamps that make it really visible. The EBT card looks exactly like a credit card, and so folks don't feel ashamed to utilize a benefit when they need it the most. Restricting foods would require a separation on the grocery cart. It would very much signal to folks around them that this is a SNAP recipient and can only buy certain foods.
Thank you. Studies that track the impact of SNAP on the physical health of recipients find that participation in the program is linked with positive improved nutritious outcomes, lower healthcare costs, and improved current and long-term health. However, prior to 2021, Thrifty Food Plan reevaluation, the Urban Institute found that SNAP did not cover the cost of low-income meal in 96% of U.S. counties, with both urban and rural counties seeing the highest disparities, and USDA's Economic Research Service estimated that 49.7% of SNAP households were food insecure in 2019. Ms. Brown, do you think that the 2021 Thrifty Food Plan reevaluation and the resulting benefit increases are furthering SNAP's positive impact on the health and well-being of its beneficiaries?
I absolutely do. It was long overdue, and we're really excited to see some of those increased benefits show up with our participants. I also will note that inflation has greatly increased, and we need to balance benefits and continue to work on the Thrifty Food Plan to keep up with the market prices.
Thank you. Mr. Chair, I yield back.
Thank you. The chair now recognizes himself for 5 minutes of questions. Thank you for holding this important hearing as we seek to provide long-term economic and nutritional security to those challenged in our nation. It is my fundamental belief that everyone deserves the chance to shape a stronger future for themselves and their families. At the same time, we must provide access to the long-term tools to address food insecurity and ultimately build a better life for those in need. First, I would like to call attention to the important work of the Ohio Association of Food Banks, including the Greater Cleveland Food Bank, and Feeding Medina County, through public partnerships with 3,600 hunger relief organizations across my state. Last year, the Greater Cleveland Food Bank provided 10.8 million pounds of food to families in need, including 94,000 children. Similarly, the Feeding Medina County Food Bank, among other efforts, must needs of underdeserved older citizens across the region. The agricultural community also plays a key role in addressing hunger, including in my state through the Agricultural Clearance Program, providing wholesome food to families struggling with food insecurity while enabling a meaningful outlet for farm goods. As a nation, we owe it to these individuals to identify policies aimed at helping low-income families achieve the type of opportunity that every American deserves. By providing greater access to workforce training, education, employment placement, and job retention services, we can empower individuals to build a foundation for a stable, productive life for themselves and a roadmap to achieve a long-term goal of self-sufficiency. That is why I was proud to co-lead Training and Nutrition Stability, H.R. 3087, with committee members Alma Adams and Mark Molinaro, along with Adriano Espilat, to ensure those in workforce training programs are able to maintain access to nutrition benefits while completing employment training programs to bolster economic security. Our bipartisan bill would ensure job seekers in programs authorized under the Workforce Innovation and Opportunity Act and the Supplemental Nutrition Assistance Employment and Training Vocational Rehabilitation Programs may leverage job-driven training programs dollars and maintain them nutrition benefits, leading to long-term employment and economic stability. Toward this end, I would like to recognize the work of training facilities across the country, including the Center for Employment Opportunities operating in the state of Ohio, as well as Pennsylvania, Georgia, and many other regions, through bold innovation helping underdeserved access employment opportunities through on-site workplace training, jobs placement retention, enabling pathways to long-term sustainable career opportunities. Participants like Mr. Rice in my district demonstrate that SNAP E&T can work after gaining work-based learning on a transitional job through local partnerships with employers to provide work experience and training to challenge participants. He learned skills, was hired full-time, and he's now building a foundation for the future. Dr. Rashidi, you note in your testimony, SNAP must accomplish its core goal of supporting Americans in their path out of poverty. Can you please share your perspective on the critical nature of providing access to job training, including the importance of provisions within the Training and Nutrition Stability Act to allow those in critical federal workforce training programs to maintain food security and engage in employment training to assist individuals toward long-term security?
Thank you for the question. I do think employment and training is a crucial component of SNAP. In New York City, when I was there, we ran a very robust employment and training program. Part of the problem, though, is there are many employment and training programs in SNAP that are not very robust and not very effective. So I think that while there is a role, the federal government could do a better job in holding those programs accountable for achieving results that actually do help people get employment and put them on a path towards upward mobility.
Thank you. Mr. Hodel, in your testimony you stated, alleviating hunger and malnutrition is a complex challenge requiring a multifaceted solution. How can Congress best enable and leverage public-private partnerships to meet the needs of underdeserved citizens, and what is the most effective role for the agricultural community to play in getting wholesome goods from the farm to those in need, and what barriers do you see in meeting these challenges ahead?
Yeah, thank you. Great question. Again, I think about it as a mathematical equation. It's an and, right? We have individuals that are purchasing food, and they get food from the food banks, and they have SNAP. And I think, what are the best programs to figure out the total equation? I would strongly endorse farmers to family food boxes. The exception or the difference, I would say, is utilize the food bank to do the packaging. When you think about the Ag Committee, to be able to support farmers and have a market, an additional channel for them to have to sell their goods, get that to a food bank that has this cooler and the freezer capacity. We can package it with our volunteers and then get it out to our agencies. I think that would be a tremendous solution to add to the portfolio of solutions that you offer.
Thank you, sir, and I yield back. I now would like to recognize Mr. Costa out of California for 5 minutes of questions.
Thank you very much. Members of the committee, I know it's been a long hearing, but I think it's been an important one. I want to concur with the ranking member, Mr. Scott, in his opening comments. I think that we do have a consensus among members here on our side about, I don't know if it's the oath that physicians take that thou shalt do no harm. Clearly, my district has the largest percentage of SNAP recipients in California. And Congressman Valadao has a similar high number. There's a lot of contrast between significant wealth and significant poverty. And a lot of our folks are among the working poor. They're seasonal, working not only in the field, some of the hardest working people you'll ever meet in your life, but also, and we have, I think, the highest minimum wage law in the country. But yet, with seasonal employment, family of 4 or 5, oftentimes that's not enough nutrition to feed a family. And so I think that we need to be very careful when we make generalizations in terms of what changes or reforms. And this is my 4th Farm Bill reauthorization. So this issue comes up every reauthorization in terms of how do we best provide food to the safety net, because the Farm Bill is a safety net. It's a safety net for American agriculture, and it's a safety net for those who are socially and economically challenged in our country. And that's the way I look at the Farm Bill. So under the category of thou shalt do no harm, Ms. Royal, you talked about issues of experience in New York. How would you describe your view of the application of food stamps and our SNAP benefits, women, infants, and children in California, and the distribution and how we've done that with the state's own efforts?
As it applies to integrity, could you repeat the question? I'm not sure. I'm not sure how that
How would
applies
you
to
rate the
integrity.
program in our application and distribution of SNAP in California?
I can't answer the question.
Okay, well, that's fine. Ms. Brown, do you have any perspective on the California efforts?
Unfortunately, my only familiarity with California in terms of their recent efforts are around their success with online benefit applications, since we modeled something similar. And so in terms of their ability to access and create access to benefits, that's more of what I'm familiar with.
And how would you describe that? As being successful?
Very successful. I think using technology with some strong supports and having the ability to increase our access points for folks that are disabled, rural communities, unable to reach transportation is incredibly beneficial.
This is a subset of that point you just made, but I've learned that convenience stores, a lot of our poor communities, that convenience store, and it's not really a grocery store, is where they can pick up groceries. I'm told that you can use a SNAP a card or a check for food that is in the freezer as you take it out. But if you take items that are heated, that you can't use that. Is that correct?
That is correct.
Don't you think that's something we should change? I mean, that makes no sense. You're in a convenience store, you're hungry, you're coming lunch, you're working, and you can't buy the chicken or the other kinds of food that's heated there. I mean, if you're lucky, they may have a microwave and you can buy it in the cold freezer, the burrito or something, and then you pay for it with your SNAP credit, and then you heat it in the microwave. But that's something we could change here in the Farm Bill, don't you think?
That is something you can change. I'll also say it impacts our homeless population, who often doesn't have opportunity to cook in a hotel room or in a shelter, and so greater opportunities are.
Well, I would hope that's something we can get bipartisan support. It doesn't seem to me a heavy lift. I mean, we're already agreeing that they can use the SNAP benefit in a convenience store, but we're saying if it's heated, you can't use it, and if it's not, you can. Makes no sense. My time's expired. There are going to be other things we need to work on, but I think that, as the ranking member said, we ought to find bipartisanship as we have in the past to produce a farm bill this year, and I'll continue to work with everyone. Thank you.
Thank you. And now I'd like to recognize Mr. Molinaro out of New York for 5 minutes of questions.
Thank you, Mr. Chairman, and thank you all for spending the day with us. This obviously, this title is not only significant, many times it causes a bit of controversy and contention. I've been here for much of today's testimony. I want to frame my questions, although I do want to acknowledge Ms. Brown, Minnesota's work to broaden access to SNAP. And those touch points that you referred to. Also, by the way, use of technology to reach to communities that are often untouched. And I only offer that in this as a way of framing what I hope will be a question at some point in my comments. I spent the last 12 years as a county executive in the state of New York. We are responsible for the delivery of food stamps, TANF, Medicaid services. That is, while the federal government says this is a state responsibility, which it is, and I would remind my colleagues, Republican and Democrat, that we empower states to administer these programs. And there is no prohibition from the federal government to use other state supports or federal supports to create the connection necessary to provide access, for instance, to those dealing with housing insecurity. There's no prohibition. The state can't provide laundry care. There's no prohibition. The state can't provide wraparound mental health supports. There's no prohibition that the states can't engage in the kind of extra supports necessary as a supplement to SNAP. In fact, that's what we empower states to do. And states like Minnesota, and to some degree, I would acknowledge New York, have attempted to do this. However, I can tell you over the 12 years I administered SNAP and social services in my county, I saw a culture change. Historically, Dr. Rashidi, as you know when you testify, historically, states were encouraged by the federal government with a very firm mission statement. Use SNAP as a tool to help people get to their own degree of independence. I'm going to pause here and say what my colleagues from New York have often heard me say. I grew up on food stamps. My mother was undiagnosed depression. I thought every mom slept into 11 o'clock, and I thought every kid got a free lunch at school. But my mom worked hard. Don't tell the unhired IRS agent. She probably worked off the books a bit. And we got back on our feet. I'm grateful for the support structure. But when we started to move into self-sufficiency, the agency was encouraged to help people find work. And didn't leave people to simply navigate a massive labyrinth of bureaucracy. But quite frankly, what the federal government has done, and this very dialogue has devolved to, is how much more money should we or should we not spend? Or let's demonize or not demonize a particular group or individuals. The truth of the matter is we have a robust system. We just don't effectively use it. And we haven't empowered states and encouraged states and incentivized states to truly engage in the kind of support necessary to help people find their way to their defined independence. My mother's independent now, diagnosed with depression, gets the services and support she deserves. My daughter receives Medicaid services as an individual with disabilities. I understand the challenges, but allowing this debate to simply devolve into how much more or how much less we're going to spend is just foolhardy, because ultimately the mission statement, to use the term I think Mr. Doar used some time ago, or a week ago, the mission statement of agencies administering SNAP has changed from helping people to processing people. And states like New York have taken enormous amounts of federal taxpayer money to simply support bureaucracy, and instead leave people to feel worthless as they are dehumanized in a system that doesn't care too much about them. You might, Ms. Brown, your staff might, I'm certain. My social service agents did, but the system didn't. Dr. Rashidi, I just want to return to this concept of the mission statement. I was very grateful, authored the one sentence, I think it's a paragraph in the Fiscal Responsibility Act, that talks to changing or reestablishing that commitment to finding work for people. My question is simply, can you speak to the value of pointing state agencies in that direction? And that likely will be my only question.
Yes, I think there's tremendous value in it because, as you mentioned, over the past at least 15, 20 years of my career, I have also seen this shift away from employment. And part of that is because states are very good at processing checks, but they're less good at engaging participants and helping them find a path into employment. So I think by the federal government making it a clear purpose of SNAP to help people find employment, I think it not only sends a message, but it also allows the federal government to hold states accountable for achieving that goal.
I have 10 seconds for one last question. What state spends more than New York on social service, Medicaid, and SNAP? Which state is that?
Maybe California, but I don't think there's many. I think it's probably New York.
It is New York. Spends the most on Medicaid, TANF, and SNAP combined, and yet we still trap people in a bureaucracy that's dehumanizing.
Thank you. I would now like to recognize Ms. Crockett out of Texas for 5 minutes of questions.
Thank you, Chairman. And thank you to all the witnesses today for your time. Let me be clear, my colleagues and I stand united against efforts to take food away from veterans, children, families, or any vulnerable American in the Farm Bill or in any other legislation. Any cuts to these life-saving benefits would disproportionately affect the folks who make up the majority of my district, which is Black and Latino Americans. Any cuts would be borne most severely by these same communities, which are significantly more likely to go hungry due to years of systemic disinvestment. In 2021, Black seniors were nearly 4 times as likely, and Latino seniors were 3 times as likely to experience food insecurity. That is why SNAP is so important to the 100,000 seniors in my district, which is over 40% African American and over a third Latino. Statewide, SNAP is critical to more than 3.2 million Texans who depend on it to put food on their tables each month. And let me pause here. I haven't been here for the entire hearing, but we do know we're talking about $6 a day. I just want to make sure that those at home recognize that we're not talking about a lot of money. I know that there was a lot of talk about how much money. And as we recently had our conversations as it relates to the debt ceiling, there was an increase in defense. And so we decided that we were going to cut $6 a day. I don't know how you balance any budget whatsoever off of that. But I did need to interject that we felt like that was really where all the fat was trying to feed hungry people in this country to the tune of $6 a day. And I can't buy a sandwich for $6, but nevertheless. With this includes close to 400,000 elderly adults and over 1.8 million children. In my district, over 45,000 households use SNAP in 2021. That is 16% of the households in my district. But what's most concerning is that only 36% of SNAP-eligible seniors actually participate in the program, far below the national average of about 50%. So instead of talking about kicking people off the program, we should be focused on improving SNAP accessibility. In my home state of Texas, seniors are losing access to, or sometimes never even receiving, these crucial benefits due to difficulties they face in accessing the internet, navigating complicated applications, and dealing with onerous recertifications, even though their income hasn't changed. But we aren't doing anything about that. Instead of pursuing made-up problems with policies we know don't work, like time-limiting benefits, we should be working on how to modernize SNAP to solve the problems of our constituents that they're actually facing. In fact, I got another plug right here. I had an opportunity to visit with a number of the food banks in my district that have talked about how we have modernized in this country. I use Uber Eats all the time. People use DoorDash. They use all of these different things. And so I know DoorDash was actually one of those companies who had agreed to deliver boxes of food to seniors, but because of the bureaucracy and the paperwork, if they weren't there to physically sign for the food, then the DoorDash delivery could not leave the food for them because they can't go about kind of just doing it on an app like many of us in this country do. So it is time for us to catch up with the times. Ms. Brown, I was incredibly interested to read your testimony about Minnesota's benefits application portal, which has improved application times from over an hour on the previous paper version to about 13 minutes on average. Can you tell us more about the process for developing and launching MN benefits?
Yes, I can. Thank you for the question. So we partnered with Code for America, who was able to provide resources to us free of charge. And they worked with our IT systems to really look at what are the necessary questions we were asking and how could we utilize technology to really streamline the process behind the scenes and not on the backs of the individuals who are applying for the program. And so with that, we've had incredible success. People are incredibly happy with the length of time that they can, go through the application. And furthermore, they can do it at all hours of the day. In the traditional model, if you're open from 8 to 5, if you work different hours, it was really difficult for people to get to the social service office. So,
and speaking of working, just to be clear, currently SNAP does have work requirements. Isn't that correct?
That is correct.
Thank you so much.
I'd now like to recognize the gentleman out of New York, Mr. Langworthy, for 5 minutes of questions.
Thank you, Mr. Chairman and Ranking Member Scott. Dr. Stover, as you know, farmers and ranchers have the opportunity to work alongside the retail community through programs such as GusNIP. These programs are a win for local businesses and farmers. In New York State alone, more than 100,000 families have utilized the program. Over 5.2 million pounds of produce have been sold, and the economic impact on farmers in our communities has totaled more than $8.3 million. Constituents receiving benefits in my district are able to increase the number of fruits and vegetables being consumed through these incentives at certain retailers. What role do you believe incentive programs play in supporting the health of SNAP participants?
Oh, I believe both education and incentive programs are absolutely essential. The intersection of health, if you want food to promote health in the population, it's an intersection of the food environment, the food that's available, and then the ability of the consumer to make the healthful choice. And we need to work on both of those, and that's a very innovative program, and we have to make sure that we get the food environment right and that we have, agency within individuals, the ability, the knowledge to make the right choices.
Dr. Rashidi, I'd like to open this question up to you as well.
I do think incentives play a role, but I do think we have to be clear about the evidence around GusSNP. It did marginally include vegetable purchases, but it was fairly small. So if we're thinking about the problem of diet quality, an incentive program like GusSNP, while useful, is not really going to be a game changer. I will add there were some comments about restrictions. I agree. I don't necessarily like telling people what they should eat or what they should not eat. I just believe that a taxpayer-funded program like SNAP, billions of dollars, of federal dollars, taxpayers should not be subsidizing poor diet and poor health. So I think there's a role for incentives, and I think there's a role for restrictions.
Thank you. Ms. Royal, no one's been immune to skimming, but it is particularly bothersome when a household in need falls victim to criminal activity. Now, while some congressional action has been taken in the Consolidated Appropriations Act of 2023, it may have simply provided a roadmap for bad actors. Ms. Royal, from a national perspective, can you tell me more about skimming and how we as policymakers can stop it?
Skimming is an attack on benefits. It's a way to use technology to recover information and then use that information to drain SNAP accounts. Ways to prevent it, a lot of the skimming instances also arise from recipients using the simple password, the 1234, the 111. Again, those sequential passwords. Making sure, putting in mandates that we can't use 1234. And I realize that that comes with complications, but when we're talking about draining an EBT card versus complications in requirements on PIN numbers, it seems to be an easy trade.
Very good, thank you. Switching over to food waste, Mr. Hodel, across the U.S., almost 40% of our food is wasted. That's 130 billion meals worth almost $408 billion. I and a lot of my colleagues, we're concerned about the cost of addressing hunger. Can you talk a little bit more about how food banks like yours work with grocery stores and other sources to capture food that might otherwise go to waste, and where can we work to do more of that?
Yeah, so thank you for the question. Again, we have a procurement director, we've got logistics folks that they're very tied in. And we know when a grocery store especially, or a supermarket or distribution center has food that's in excess, or they need to get it out of there. So that's one of our driving forces is we have a fleet of trucks, we have drivers, we have access to trucking companies across the country so that we can quickly remove that from their business. They're trying to run a business. And we're able to quickly capture and rescue that and bring it into our facilities. We've invested heavily in our facilities with freezers and coolers so that we can bring that in. And then we have a variety of distribution models. So not all agencies are created equal. We have small to large. We have local versus more distant. So again, we have different distribution models so that when we get something in, that we can quickly turn it out to those agencies, that they can get it to their food recipients. I think an incentive or a promotion is carbon credits. As we think about how much are we rescuing that is not going to a landfill, and then how do we reward and incentivize those companies and give them credit for the reduction in carbon.
Thank you very much for the testimony from all the witnesses, and Mr. Chairman, I yield back.
I thank the gentleman. Before I recognize our next member, I just want to ask unanimous consent to submit for the record an article, May 31st, Reuters article on the number of job openings, including industries like healthcare, transportation, logistics, and utilities. Without objection, we'll enter that into the record. Now I'm pleased to recognize the gentlelady from Oregon, the mother of a recent high school graduate on Friday. Congratulations to you and Amelia.
Thank you.
And recognize Mrs. Salinas for 5 minutes.
Well, thank you, Mr. Chairman. Thank you for your kind words. I want to start by saying I actually agree with my colleagues in the majority. I think we need to encourage opportunity, and I think we need to do that with all of our government programs. Sadly, that's where it ends. So nearly 17% of households in my district depend on SNAP to put food on their tables, and each month. And that's about 1 in 6 families in Oregon's 6th district. But I'm particularly concerned about a certain population, and that's those who attend community college, so our community college students. I want to again thank the chairman, Thompson, and Congresswoman Lori Chavez DeRemer, who both serve on this committee. We're down in Albany and out in the state of Oregon this past Friday. And we were at Lynn Benton Community College, where we heard that the average student is 27 years old, and about a third of all those are parents. And so we're talking about non-traditional students, many with dependents trying to piece together work, caring for kids, going to school, and yes, putting food on the table. And a recent study from Johns Hopkins found that food-insecure students were more than 40% less likely to graduate from college and more than 60% less likely to earn a graduate or professional degree. Despite the importance of nutrition to student success and what I would consider increased opportunity, recent surveys estimate that as many as 30 to 40% of college students are impacted by food insecurity. And unfortunately, SNAP's strict eligibility rules for students enrolled at least half-time make it difficult for many to get the help that they need. And supporting food assistance for college students is an investment in opportunity and in human potential. And I have my own personal story around this. It was really difficult. My parents could not pay for college. I worked so many jobs. I think I worked 70 hours a week. Sometimes I was full-time, sometimes I was part-time, but they were able to help me put food on my table. And I know a lot of kids these days and non-traditional students just cannot. So I believe strongly that we need to make it possible for the millions of students that want to follow in a similar path to mine, who we need to enable them to make those ends meet while pursuing that education. So Ms. Brown, how accessible is SNAP to students enrolled half-time or more, and what barriers do people who are already participating in SNAP face when they try to enroll in higher education to further their work prospects?
Thank you for raising this important issue. 1 in 5 college students are parents. And adding on to some of the stats that you shared, we believe that student policies need to be modernized. When the program policies were put in place, the traditional college student looks much different than what it looks like today. So during the pandemic, the COVID provisions that were passed were incredibly helpful. We heard from college students all across the state how grateful they were for that. So what that did is it loosened the student eligibility criteria, which allowed for work study placement to occur. And what we have in Minnesota is that some college students that are eligible for work study are unable to get a work study placement simply because there aren't enough. And so that's a particular barrier that is incredibly important to really solve. We also are interested in seeing a blanket exemption for all income eligible students if they are enrolled in a 2-year community college or a technical college program, again, with the idea of boosting up and removing barriers for student populations.
Thank you. And then also, just in my last minute, I'd like to ask about the mechanism SNAP has in place to address the benefits cliff families might face if they're able to increase their earnings to the point where they are no longer eligible for SNAP. So Ms. Brown, can you speak to how utilizing broad-based categorical eligibility, or BBCE, impacts SNAP recipients in your state? And then what kind of benefit cliff, if any, do they face when they become ineligible for SNAP?
Yeah, thank you so much. So the broad-based categorical eligibility does allow households to save for the future. That's the number one piece, and it really does soften that benefit cliff. So we want people, in order to be successful and not churn on and off the program, to really be stable when they leave the program. And so if we can soften the benefit cliff and utilize all the exceptions and the flexibilities states can employ, then we will have a much more stable population and people more successful.
Thank you, and more opportunities ahead. I mean, it really does go to show that we do need some safety nets there. So thank you. Thank you again to Mr. Chairman for coming to our great state of Oregon to hear the needs of our state, and I yield back.
It was a pleasure. Thank you for the hospitality. Before I recognize the gentleman from Tennessee, I do want to make a unanimous consent request to submit for the record a May 23rd Wall Street Journal opinion where the author lays bare how public policy has made unemployment too attractive for some healthy adults. Without objection, so submitted. Now please recognize the gentleman from Tennessee, Mr. Rose, for 5 minutes.
Thank you, Chairman Thompson and Ranking Member Scott, for holding the hearing, and thank you to our witnesses for your time today. I know you have lots of things you could be doing, and we appreciate you being here with us. I want to begin with Ms. Royal. As a member of the United Council on Welfare Fraud, do you believe that welfare fraud is a victimless crime?
Absolutely not. The victims are the taxpayers. The victim is the program itself.
And thank you for that. You anticipated my follow-up question, so I'll move on then, and thanks for that clarity. Mr. Hodel, your testimony mentions weekly deliveries to Eastern Kentucky with future projects for Mississippi and Louisiana, and a mention of a pilot program to support the super rural communities, close quote. Knowing these are high poverty areas, how do you succeed in getting food to these communities in need?
Yeah, it's teamwork. We're using data analytics to look at the high poverty counties, and districts, and then teaming with corporations that have a philanthropic element. Obviously, more and more, I would say, companies are looking for their proof to be able to show their employees that they're giving back and they're caring about communities across the country. And so two different programs, but one is procuring food, packaging, basically family food boxes. One's shelf-stable and one is perishable. And then utilizing logistics companies, and they truck the food from our location down to Eastern Tennessee, and then utilizing a local agency to do the distribution. And actually I had, of the 944 households that we dropped off, or the agency dropped off and delivered, only 7 missed the delivery. So we've had really good response to be able to take a family food box to a house, many times that don't have a door or don't have windows, and they're clearly in need. So that's teamwork kind of across the supply chain with corporations and companies and agencies.
Thank you. And to serve these areas for a season and not a lifetime, are there, and I think I just said that backwards, for a lifetime and not just a season, are there opportunities for collaboration with employers, career and technical education providers, and other service providers to give these families the support that they need to move from poverty to true independence?
Well, absolutely. Yeah, we talked about junior colleges, and the one thing I would add is we actually have a lot of food pantries in junior colleges. And they're able to put those food pantries in place because we don't charge for our food. So it's an opportunity for a college student to come get food. But I do think companies, employers, will see where manufacturing companies, trucking companies, they'll reach out to Midwest Food Bank and they will have an activity. They'll do a food packaging drive at their facility to drive awareness about Midwest Food Bank. But they also know then that it's a support system for the community. And there's probably some employees at those locations that, based on their situation, maybe have to use a food pantry at times. So again, I think it's community collaboration, but primary, secondary, post-secondary education and training and connections with the local employers in the area, I think is really, really key.
Thank you. I completely agree, and would just stress, the old adage of give a man a fish, you fed him for a day, teach a man a fish, you fed him for a lifetime, and came up through the FFA program and appreciated the important lessons there of teaching people how to feed themselves and grow the food to feed themselves. So I embrace everything you just said. Mr. Hodel, one photo from a once-a-month distribution was used repeatedly throughout the pandemic to demonstrate need. While it suggested demand, it also suggested logistical failure. What has your experience been? Have you seen dramatic lines? If not, how have you supplied your demand with efficiency?
Yeah, we actually saw the opposite. So during the pandemic, and I'm familiar with the photo, but we actually more fine-tuned our supply chain and our planning of our agencies to pick up because we needed to just kind of space people out. And so we were, again, with integrity, trying to make sure we were respectful of their time. So we kind of dialed in our schedule to make it really clear that we need you to come at this time to pick up your food. And we had it kind of prepackaged and ready for our volunteers to load their vehicles. So our experience was just, again, making sure that we dialed in our our planning and our logistics to be respectful of our agency, so they did not have to wait.
Thank you, Mr. Chairman. I yield back.
Thank the gentleman. Before I recognize the young lady from Virginia for 5 minutes, I would just request unanimous consent to submit for the record a May 24th Wall Street Journal article that articulates how desperate states are to keep people idle through waivers. Without objection, now please recognize the gentlelady from Virginia, Mrs. Spanberger, for 5 minutes.
Thank you very much, Mr. Chairman, and thank you to our witnesses for being with us. There's been a number of conversations and questions posed throughout this hearing, some directly related to the topic and some not. There was a question posed of Ms. Brown about the time it takes for an asylum process to go through an application. The answer to that question, though, Ms. Brown, given your specialty and expertise, was probably misdirected at you, is 4.3 years. And so individuals who may eventually become eligible for SNAP benefits once they are approved, it's an average of 4.3 years, with some taking more than a decade. And Mr. Chairman, I ask unanimous consent to put this document into the record, substantiating that. There was also
without objection.
Thank you. There were also questions related to work requirements, and implied in the question was a little bit of an implication, or that in fact work requirements are not in place, and that they're not currently supported. Work requirements are in place, and so I submit for the record, or I ask unanimous consent to submit for the record, the statute related to existing work requirements, which do indeed already exist for many SNAP requirements.
Without objection.
Thank you. There was a question related to veterans and how removing some of the requirements related to hurdles that might be in place for veterans to get SNAP benefits, whether that would hurt veterans because they wouldn't be required to take education and training programs. So Ms. Brown, directed at you, while those requirements are not in place thanks to the Fiscal Responsibility Act, for veterans who choose to participate, that option is still on the table, is it not?
That is correct.
So we are not disadvantaging veterans by removing a hurdle for them to have access to affordable food. Is that correct?
Correct.
There are, though, substantial challenges with some of the state-run programs for education and training. That's another matter. Is that also correct?
That is correct.
Thank you. There was a comment about the fact that an individual on the committee went out and just found a $14 paying job. I would just like to state for the record that the federal minimum wage continues to be $7.25, and a tip wage worker, it's $2.13. If any of my colleagues want to join some of us in raising that to a $14 level, I welcome them to do so. Related to the Farmers to Family Food Box program, notably, I think there was, in the immediacy of the pandemic, this program showed some strength, though notably, a $39 million contract went to an event planning company out of Texas. There's story after story of abuses of the program. And so when we're moving forward trying to find programs and ways to leverage federal dollars to help people and help communities, my attention's drawn to my state, the Commonwealth of Virginia, where agriculture is our #1 private industry. And what I see in my district is the fact that local farmers are able to participate in programs such as community food projects. The GusNIP program is incredibly helpful in helping leverage SNAP dollars. And in fact, the regional food business centers are something that I do hope this committee will codify when we move forward with this farm bill, because they have been so incredibly helpful to the people that I serve. And with that, I want to just speak to another population that continues to face food insecurity, and those are active duty service members. In the Commonwealth of Virginia, we have the second highest population of active duty service members, second to California. And in Virginia's 7th District, I am proud to represent so many of them. My colleagues have spoken about veterans who also face food security challenges. A 2020 survey found that nearly 1/5 of active duty military families in Virginia say they can't reliably afford food. The survey also found that lower ranked service members, those who considered suicide, and those who are experiencing loneliness were more likely to experience food insecurity. These stories, these experiences are not rare or unique to Virginia. According to the U.S. Department of Defense, 24% of active duty service members experience food insecurity at some point over the course of 1 year. That's almost 1 in 4, and even our colleagues here today have spoken of availing themselves of food security programs while they were active duty service members. During my career, I've spent many years working to keep our country safe from a wide variety of threats, and I can tell you hunger among our military families is a national security issue. It's unacceptable that military families struggle to put food on the table in the richest, most powerful country in the world. Those who defend our nation do not deserve to go hungry. And while the conversation today has included some programmatic improvements that we could make to our food security program, some improvements to education and training, to the administration of the program, encouraging access to healthy foods, simplifying the programs, and of course eliminating fraud, I also want to join my colleagues in saying that I refuse to accept senseless changes to SNAPs that would harm our nation's service members, veterans, and any other vulnerable Americans by taking food away from them in the 2023 Farm Bill or any other way. Thank you. I yield back.
Gentlelady did that very nicely, getting in under the wire. I didn't think you lived that far north to be able to speak that fast. I mean, it was really good. Before I recognize Mr. Johnson, I want to ask unanimous consent to submit for the record a May 17th, 2023 Wall Street Journal article regarding the sensible reforms in the Fiscal Responsibility Act. Without objection, so submitted. And now I recognize the gentleman from South Dakota, Mr. Johnson, for 5 minutes.
Dr. Rashidi, your testimony references the relative lower health outcomes for SNAP recipients, which I think is, of course, concerning to all of us. I assume that health is highly correlated to employment, and so then I wonder if SNAP recipients would have correlatingly lower work outcomes. Is my assumption right? And then if so, what do we do about that to make sure that people are healthier, more productive, happier? We've talked about some programmatic improvements, but what are we missing?
Yes, thank you for the question. This is actually one of my main concerns about SNAP, because SNAP obviously draws to the program just an unhealthier population, because that's likely why they can't work, which is why they're low income, which is why they need SNAP. So it does draw an unhealthy population somewhat by design. But the problem with SNAP is that once that unhealthy population comes to SNAP for help, SNAP actually contributes to poor health by reducing diet quality and also disincentivizes work, which we know leads to further deterioration of health. So in the reverse, really SNAP should be looking at those with poor health as an opportunity to improve their health and make them more employable so that they can, in the end, escape poverty.
So I do not have it in front of me, but there was a Federal Reserve report a number of years ago that I reviewed that indicated, that did time studies on work-capable individuals who are not working. And not surprisingly, there was a big difference between the way that unemployed women spent their time versus unemployed men. Unemployed women are so often the custodial parent. They were spending huge chunks of their day on care for dependents. With the young, work-capable men, that was less the case. And the time study results, as I remember, was early on they were spending a fair amount of time trying to be work-ready and look for work. If they didn't get a job relatively quickly, how they spent their time changed dramatically. And that they began to spend more time on television, on a smartphone, on other entertainment devices, and that there was a corresponding precipitous drop in their mental health. Does that sound about right? Is that consistent with other research you've analyzed and any other observations you'd have about what sounds like, frankly, a serious problem for the behavioral health of Americans generally?
It is, and it's exactly correct. So Nick Eberstadt, who's a scholar at AEI, has done work on time use surveys and documented that, especially among men, those who are prime age and not working, they spend their time mostly in front of screens. And then we have the literature that suggests the longer people are out of the labor market, their health deteriorates even more, and even mental health issues. So you can imagine a population that's becoming further depressed because they're not working, spending a lot of time on screens. It's just contributing to the problem rather than trying to help them.
And I would, I think both sides of the dais, and by the way, I think we all know this committee is generally far more common ground seeking than many of the food fight committees in Washington, and that's one of the reasons that I'm so proud to serve here. I do think sometimes the rhetoric many of us can use about this issue can be a barrier. I do think everybody in here ultimately shares the same desire, which is how do we allow people to live happier, more productive, healthier lives. We may have tactical disagreements about the best way to do that, but I do observe that we all accept that to get stronger in athletics, you can't just jog at a comfortable pace. That growth comes outside of one comfort zone. And of course, that's true for a high school cross-country runner, but it's also true for each of us in our personal relationships and our professional relationships. And I know that every human being I've met is better positioned to grow outside of that comfort zone if there's some accountability, if there are not just accountability, but some supports, right? And ultimately, I think looking forward, we do know that work requirements can play a role there. We know that job training programs can play a role there. We know that job seeking supports, including childcare, plays a role as well. And so I would just thank you for the research that you and your colleagues have done, because ultimately, we cannot afford to have the kind of precipitous decline in physical health and mental health that the research you're discussing describes. Thanks much. I yield back.
Gentleman yields back. For I recognize a good friend from Florida. I would just ask unanimous consent to submit for the record Dr. Rashidi's May 2023 article, Perspective on Better Health and Employment Outcomes for SNAP Recipients. Without objection, the article is submitted. Now please recognize the gentleman from Florida, Congressman Soto, for 5 minutes.
Thank you, Chairman, and thanks for coming to Florida for the listening tour just a few weeks ago. It's been said often on this committee and by both sides of the aisle that we live in the most powerful, most prosperous nation in the history of the world, and that no American family should go hungry. We also have incredible farmers. The American farmer is the most productive in the world as well, which helps give us this blessed bounty. I want to go through some of the facts about SNAP. First, SNAP is effective. It serves over 42 million Americans. SNAP is also a critical program for our local agriculture. I've spoken to many ranchers and growers and farmers in my district who work with our state and with the federal government to help provide the food for the SNAP program. SNAP has modest benefits. The average benefits are $2 per person per meal, $6 per day. As I've mentioned that to some of my constituents, a lot of folks have been shocked about that number. And lastly, SNAP also helps our most vulnerable Americans. 80% of the program are children, the disabled, seniors. We also have a lot of veterans who are able to get SNAP benefits, as my colleague, Representative Spanberger, mentioned so well. I talked to some of our local nonprofits like Osceola Council on Aging in my district about persons with disabilities in my district who are receiving SNAP, and they talked about a gentleman named Arman, who is a constituent of mine in Central Florida. He's a senior who lives alone with diabetes, suffers from heart problems, uses a walker. His food stamps have already been cut from $150 to $50. If there were further cuts, he will be in an increasingly worse situation. Right now, he tries to make things work by working with other charities and churches and the like, and we applaud the work they do, but the funding and the food there is not consistent. We know that a household containing an adult with disabilities is estimated to require 28% more income to maintain the same standard of living as a similar household. SNAP can serve as a vital lifeline for Americans in this situation. In Florida, more than 288,000 non-senior adults with disabilities participate in SNAP each month. Nationally, in 2020, 22% of SNAP households, over 4 million households, included non-elderly adults and children with disabilities. That's why I feel strongly about these programs, and I hear it from my constituents every day. Ms. Brown, How can we improve SNAP benefits to ensure Americans living with disabilities like Armand can afford healthy, nutritious food? Because $50 doesn't seem like a lot of money each week. And are there ways we can adjust, monthly, forgive me, and are there ways we can adjust things like SNAP work requirements and medical deductions to ensure low-income disability individuals have better food assistance?
Yeah, thank you for the question, and thank you for the example of the constituent. I think that's an important example because it shows the conditions that your constituent has, not as a result of SNAP, but they're utilizing SNAP to help despite all of the conditions that they're dealing with. And I think there's been a few statements made that are really ignoring the conditions that folks have are entering into SNAP, and SNAP is not causing those conditions. So I want to make that point. I also just have to make another point that, when we look at a point in time data point, that does not it does not serve us well to make broad characterizations of a population. So to your point about folks that we can improve access and encourage for disabled folks, absolutely. Increased review of the medical deductions will absolutely benefit that population and encourage more to apply and to receive benefits and hopefully stabilize. We have to really be understanding of the myriad of conditions and problems that our folks have, and that's exactly why SNAP is here.
Well, thank you so much, Ms. Brown. Constituents like Armand, a disabled senior who already had his benefits cut from $150 to $50 a month. I can't imagine any family, let alone a constituent suffering from disabilities, to be able to really live on that. So I think these are the types of stories we have to keep in mind as we're looking at protecting SNAP here in the Farm Bill. And I yield back.
Thank the gentleman. Before I recognize the ranking member here for closing comments, I just would like to submit for the record a May 30th Wall Street Journal article on restoring a culture of work and safety net programs. Without objection, consider the article submitted. Now please recognize for any closing comments that you'd like to make, the gentleman from Georgia.
Well, thank you, Mr. Chairman. And I want to thank our panelists for a very engaging, informative, and heartfelt presentation. We're dealing here with fine points. What has been missed here is that this issue of work, as if Democrats don't have work requirements. We do. Up to 49 years of age. Under the bill that President Biden has just signed, the work requirements are 5 more years. So it's minor. But why do we feel we have an opportunity here to really get to the heart of the matter? Let me just share with you why I oppose moving from the 49 years of age that we have, the work requirements. You would hear from our Republican friends as if Democrats don't support work requirements. We do. But we have a reason for putting it at the age where it is least hurtful for the very people we're trying to help. Let me share with you these astounding figures so that I think you will agree that 49 years is sufficient. Once you get beyond that, you create an amazing amount of hurt to the very people that you're trying to help. 82% of SNAP households include a child. an elderly adult, a person with disability. That's in 82% of every household. And 42% of all of the SNAP participants are children. It is the children in the households. It is the grandparents. It is the parents that have to provide food from their qualifications for the food stamps. That age is so important. And that's why we Democrats feel strongly in holding this age at this pattern. We're not against people going out, able-bodied people going to work. Work is not just there when you have this type of constituency in each household. Who's going to take care of those children? The disability, the people who are in these homes that SNAP is giving the attention to. That's what's at issue here. And I'm hoping that our Republican friends will see the justification to don't add more difficulties onto our SNAP recipients than what we have now. And y'all's testimony proves this very point, that we are set. And with the SNAP requirements of work where they are there for a purpose. It's not these additional 5 years we have to concern about. We're there to help these children. We're there to help the disabled. And when you throw in our veterans who are living in food insecure households at a rate of 7.4% greater than the general population, that's why we have the work requirements where they are. That is the only difference we have. And you've heard similar commentaries from each side. There's a compassion here. Now we all just hope and we pray that our Republican friends will want this to be a bipartisan bill. But there's no way that we Democrats can turn our backs on where we are right now. All we're asking for is to keep it where it is. And you all have testified as to why. Thank you, Mr. Chairman.
Well, I thank the gentleman. I want to thank our witnesses. This panel has been unmatched in terms of your expertise and your dedication to basically what we're talking about under the nutrition title. And it's just greatly appreciated. Thank you to our members. We had tremendous participation and turnout. And thank you to our staff, all of our staff for helping to make this hearing so successful. You know, there's a couple truisms out there in this space. Farmers feed and nutrition matters. And so that's why I'm very proud to have Title IV, the nutrition title, in the Farm Bill. I think it's an essential part of the Farm Bill. And under the SNAP program, the fact that the national average is $248 a month. The national average is a little over $8 a day. Now, that's the national average. There are some differences based on the state's administrations. I want to compare that over $8 a month for SNAP recipients to the fact that the national average for expenditure for non-SNAP on a daily basis is $12 a day. And that's why we call it Supplemental Nutritional Assistance Program. It's not the full amount, it's supplemental, but the differences is pretty close. Now, as we continue our work for the 2023 Farm Bill, I hope it will keep a principled approach. Those principles were in the title of this hearing, and quite frankly, has been in any discussion that I have led or we've been a part of, not just in this hearing room, but quite frankly, all across the country, in probably about 40 states over the past 2 years and 5 months, as we've done a Farm Bill listening session to take input on all 12 titles of the Farm Bill, including Title IV, the nutrition title. That is innovation and flexibility, food and financial security, or independence, food and financial independence, program integrity, and healthy eating. You know, by focusing on principle, we can mute the politics that can be so divisive. I think we have an obligation to do that. As we look at SNAP, and I know that it can be very controversial, but it's important for people to understand that in terms of, I don't use the word work requirements. I use the word job opportunities. You know, almost 1/4 of all SNAP recipients today are working. They're the working poor. They're working 1 and 2 jobs or more, minimum wage, no benefits, and they're not getting any further ahead. And they're struggling, and they qualify financially for SNAP, and they don't. I mean, they fulfill that 20 hours a week work requirements. But it's important people to clarify that requirement, as has been in law for a very long time, is 20 hours of work or 20 hours of volunteer time. Or, quite frankly, I think one of the best ways is engagement in SNAP employment and career and technical education. You know, helping people reach a new rung on a ladder of opportunity. So I look forward to our continued discussion on where areas for improvement exist. And so with that, under the rules of the committee, the record of today's hearing will remain open for 10 calendar days to receive additional material and supplementary written responses from witnesses to any question posed by a member. This hearing of the Committee on Agriculture is adjourned.